proceed? See, I took like maybe 3 or 4 layers. You can break it only in 3 layers. It's fine. Like for example, you do not need to ask about do you want anyone to be by your side. Just say I don't have encouraging news. Doctor, tell me what's wrong, doctor. Actually, the CT scan has shown that he is having bleeding on his brain, a condition we call rupture brain aneurysm. Oh my God, doctor, what is this? Now you'll explain brain aneurysm. Simply, it is sacking or pouching of the blood vessel in the brain, and when this pouching happens, the blood the blood vessel ruptures and the blood flows. Doctor, why did he have this? He just only had hypertension, doctor, and he was taking the medication. Now you will tell her that this usually happens in case of long-standing, uncontrolled blood pressure, especially with the old age. Oh my God. Doctor, is he going to die? Okay. So now you see, you broke the news in layer. Number one, you brought him here. We did examinations and investigations. One of them was a CT scan. Has anyone told you about the CT scan result? Would you like me to tell you? Would you like me to proceed? Actually, I don't have encouraging news. Did anyone told you about the CT scan result? Actually, I don't have encouraging news. Would you like me to proceed? The CT scan shows, then you can say what it shows. Doctor, oh my God, why did this happen? Now you can say that it is because of the weakness or the rupture of the aneurysm, which is weakness or pouching in the artery, supplying the brain, and it happens usually with the old age and uncontrolled blood pressure, like in his case. So, doctor, is he going to die? Now, you do not say, don't answer frankly to this question. This question is the most challenging question. I told you yesterday when anyone asks you, what are you going to do? Or is he going to die? Or is he serious, doctor? Or is he serious? You can flip by answering like, let me tell you what we have done. Or if you do not have anything to say, you simply say that he is in good hands in the first answer. So if someone asks you this question, okay, no problem, Dr. Kachi, join right now. If someone asks you, is he going to die? You just answer like, your husband is in good hands. Team of doctors are looking after him. Then if she asks you again, is he going to die? I'm afraid that his condition is terminal. We are not expecting improvement. So now you are going to say these things. Number one, he's in good hands. Number two, if she insists, you can tell her that his condition is terminal and we are not hoping for improvement. Do not say, actually, he's going to die. Do not say that, actually, he's most likely to die. Don't say the word die because this is, I'm sorry to say, but this is like, can be hurting to the patient's feelings. Just put yourself in her place, God forbid, God forbid. You would feel the same if you hear the word die. Okay? So now what are you going to do, doctor? Aren't you going to do any surgery for him, doctor? Now you will tell her that the surgery has been decided to be not appropriate or inappropriate. Why, doctor? Because of many reasons. Number one, his age. Number two, the bleeding is severe. And number three as well, that he's unconscious, but he's breathing on his own. So the prognosis is poor, the outlook is poor, and due to the age and due to severe bleeding. Doctor, but can't you do anything? Doctor, just do anything. Doctor, just transfer him to the ICU. May I know what's your concern or what are you expecting in the ICU? Doctor, you just do anything like put him in the machine or on the breathing machine. Now you will tell her that shifting him to the ICU will not change anything because he's unconscious, but he's breathing on his own. This is number one. So he doesn't need the ventilation or the breathing machine. This is number one. Number two as well, all the facilities that he needs in the ICU can be provided to him in the ward or in the recovery room, I'm sorry. So now again, you cannot shift him to the ICU. Doctor, what can you do, doctor, please? Could you leave him like this? Now you speak about the palliative care. Definitely you will not leave him like this. We're going to take some measures to make sure that his stay is comfortable in the hospital. What are you going to do, doctor? Now you can speak about the palliative care. Number one, painkillers. Number two, some nasogastric tube. Number three, we're going to put urinary catheter. Number four, some supplements like vitamins. Number five, mouthwash. from time to time. Number 6, move the joints from time to time to prevent joint stiffness, and move him from time to time as well on the bed to prevent the bed sores. Please do not say all of them in one go. Just say two by two. Two and pause and check understanding. Two and pause and check understanding. Okay? What happened to me is that he was not interested to listen to the palliative care. He stopped me right after I told him about the supplements. But doctor, won't you do anything, doctor? Apart from this, may I know what you're expecting? He would tell you or she would tell you, doctor, won't you, for example, press on his heart? She means the CPR. So now you can tell her that the CPR has been decided not to be appropriate as well. Why? Because number one, of his age, number two, because of his condition. The MDT, the multidisciplinary team, has decided that the CPR will not change the outlook. Okay, this is the station so far. So number one, I can't do surgery. Number two, I can check the ICU. Number three, I only can do the intensive care, the palliative care. Number four, the DNAR has been decided. Okay, okay. When someone asks you, is it serious? Now say he's in good hands. If she insists on asking the same question, is it serious? Is he going to die? Actually, his condition is terminal and we are not expecting any improvement, unfortunately. But in this way, low voice tone, and please be slow. Do not be frank and try to work on your facial expression when you are entering into breaking bad news. How to break the news in layer? We have done this and this and that. Has anyone told you about the result? Actually, I don't have encouraging news. Would you like me to proceed? Would you like anyone to be by your side? Now tell the news. This is the breaking bad news station so far. Actually, we are going to follow this approach or this thing. Okay, this is the approach for any breaking bad news, and I need you to follow this in any breaking bad news station. And believe me, it is the same. It's always the same. This way, if you do it, I'm sure you will score at least 6 or 7 in the breaking bad news. With some more interpersonals, I'm sure you will get to at least 4, at least 9. But please try to take some history in the beginning. For example, don't go to break the news suddenly. No, tell me what happened and what next. Does he have any other medical condition? Was he treated? Was he taking any other medications? Like some history. Why? Because the examiner needs also to give you some marks for data gathering.
So, Dr. Ahmed, can you just, I want to know, I missed the introduction part, the first one. When the wife jumped to you and said, how is my husband? How is my husband? I'm worried about him. So when you come inside the cubicle after leaving with the examiner, what should you do? I am doctor. Should I introduce myself or should
No, wait.
Because this one.
She will jump to you. Doctor, how is he? How is he?
Yeah.
Just reassure her that your husband is in good hands. Team of doctors are looking after him. Can you have a seat right now? May you have a seat?
So I should speak slowly and.
Very slowly. He's in good hands. Just a team of doctors are looking after him. You know, I will show you right now, by the way, because after we finish the breaking bad news, the 4 stations or the 5 stations for today, I will pick up someone to practice them with me. One of them with me. Okay.
So the other question: how we can double check his ID, her ID? We should check her ID first, right?
Her ID, you mean?
As usual.
Her identity generally.
Yes.
Okay. In the beginning, after she's having a seat, and Dr. XXX, one of the junior doctors here.
Yeah.
You can tell her. Are you, for example, are you Mr. X wife? Can I confirm if you are Mr. X wife? She can tell you yes, doctor. Or you can simply tell her, so you are Mr. X wife, if I'm not mistaken, right? She will tell you yes, doctor. So can you go? Nice to meet you today. Or I believe, I prefer, yeah.
I have this station in my exam, and she was a very quiet old lady, Mrs. Ali, and she wasn't very jumping or anything. She was just sitting on the chair. So I introduced myself and asked her, if I'm not wrong, you're Mrs. Ali, and then I took the station forward. So she knows it's outside the station. It is written, "You are talking to talk Mrs. Ali."
So
So just to introduce you, I introduced myself. I confirmed her identity by asking her name, and then asked her, "Tell me about your husband," etc., etc.
okay, but this is for the breaking bad, for the rupture bay aneurysm, right?
Yeah, exactly.
But what about the other stations? The other stations, she's really worried. The simulator is really worried.
Yeah, surprisingly, she wasn't worried, but she was like, she was quite sad about it. That's it.
Sad, yes, sad
Yeah.
only. But you know, the pregnant girl is quite worried. She needs you to do anything so that he lives for 1 minute more, for one week more. Um, this is the station of the rupture bay aneurysm, and it is quite similar to the next one, the intracerebral hemorrhage. Intracerebral hemorrhage actually, or the bleeding. Generally, guys, they will bring you breaking bad news of, yeah, the Joshua parents are something else. Joshua parents are already panicking. Those guys are quite, like, how can I say? Those guys are quite unexpectable. Those guys, they are really broken, and maybe the father himself will cry, not only the mother. Okay? Okay. So next station is the same exactly, the intracerebral hemorrhage. But one thing, guys, the daughter here will ask you, it will be a daughter, not the wife, not a big difference, and it can be a son, by the way. It came to my exam as a son. And by the way, wait, let me stop the recording for a while.
Can we try to get back his attention by saying, Mrs. Smith, it is a huge thing to know that your close one is in such a condition. Is there anything I can do for you?
Yeah, but I mean,
Then,
not while crying, not while crying.
well, you see, the doctor, he said that he let him cry, and after the exam, he was crying himself, yeah, with the results. He got one.
No. Listen, the thing is that what happens in the Breaking Bad news, I need to see you while you are practicing it. Seriously. I would be lying to you if I tell you some many advices without seeing you practicing it. Why? Because it differs. Because you know why? Your approach to Elvira is different from my approach in the Breaking Bad news. If you tell me, Dr. Ahmed, I went and I did this and this and this and that, though I failed. Do you think it's only about what you did? No, it's about how you did it.
Okay, yeah. I guess I speak differently, and the Dr. Macy speaks differently.
Yeah, exactly. That's what I say.
Yeah, okay.
About Dr. Muniba, I told you that this doctor was practicing the Breaking Bad news. I kicked him in his leg because he insisted on interrupting the patient while crying. So I kicked him in the leg, and it came to him in his exam, and he scored 9 in it. So yeah, seriously, and you know him anyway.
All right.
Eye contact. Okay. Usually the patient will lose eye contact, Dr. Islam, while crying. But what you can do not show that you are bored. Do not look at the ceiling. Do not look at the examiner. Do not do these things. Just try to show that you are really feeling bad, or you are feeling like you are feeling bad, or you are showing sympathy and empathy to the patient by your look. You will see right now when I open the camera, I will do it. I just need someone to practice it with me after finishing these two things. I mean, I'm going to with 2 more stations, and I'm going to practice it with you guys. And I need someone, I think, who will be the best simulator. I think it's Dr. Elvira in this case. I need you to be my simulator in this case, Dr. Elvira. Any of the Breaking Bad news stations. You will keep the eye contact, but you will see how. It's not like a frank eye contact. It's like a sympathetic eye contact. Like you are showing her that you are sympathizing
But
with
I will be very heartbroken widow, believe me.
anytime.
Okay, yeah.
Okay, so Dr. Islam, it's always good to maintain the eye contact, but do not be too frank. I mean, do not look so boldly. Look while you are showing some sympathy and empathy, some pity to her. Okay, so here in this case, actually, what we can do, guys, this question is asked to me many times, and the people still do not believe that you should always maintain the eye contact with the patient in PLAB 2, no matter what happens. I don't care. I don't care if she's crying or something. But you know, Dr. Islam, I need you to develop the skill. I need you to be yourself. For example, what happened to me is that this guy was really, he was really, I mean, I was broken more than him. Can you imagine? I was broken for his father more than him. No, you actually, listen. I think if someone is like from Egypt or from Pakistan or from any of the third world countries, I'm sorry to say, but we are dealing with these things all the days. So I think you can never cry in such situations. Seriously, you may be like, oh my God, no, don't tell me. No, don't tell me in Egypt, because actually in Egypt, the first duty that you are going to do when you are a medical officer is to confirm the certificate. Uh, like how? Like rubbing your head like buzzing? You want to rub your head? Seriously? Well, I just need you to act like you are in your clinic, Dr. Zaid. Will you be so confused when you are telling or breaking the news back to someone who's coming to your clinic? You may not smile. Actually, it will be adrenaline rush. Your face will be red. Seriously, you will not be able to smile. I wanted to laugh for one reason, because I wanted to tell him that you are the worst simulator who came to me today. Seriously, you're a very bad simulator. And when I went out, I asked the other people, I told them, guys, did anyone have problem with the Breaking Bad news guy? They told me, oh my God, he was very cold. What's wrong with him? Maybe he was sleepy, maybe cases. Why? Because you know that the people are scripted. And they know that they will enter the cubicle saying that he's having EDH, extradural hemorrhage, and the task says that he's having pelvic fracture. Now, if you do this, unfortunately, you may fail the station. So please read the task very well. They just change it so the scripted people will be wiped away. Okay? Okay. When you enter the cubicle simply, you will find the parents, the broken parents, I can say. They are almost crying. Both of them are crying. And yes, the father could be crying as well sometimes. So she would run to you, doctor, how is my son? How is my little one? How's he? You are going to do the same. I'm here to talk to you and address all your concerns. Your son is in good hands. Can you have a seat, please? She will have a seat right now, or they will have a seat. Right now, you can talk about the thing in details. Tell me what happened, and what next, and what next, and what happened next. So you will gather some data about the incident or the event again. And now she will ask you, doctor, is he going to die? If she asks you, if is he going to die? Now you will tell her that, let me tell you what we have done. Number one, he was brought here. He was having this bleeding from his head. We have stabilized. The task, by the way, says that you have stabilized him. You have done primary survey. What is the primary survey? Stabilization of the oxygen and the breathing and circulation. This is a primary survey. So we have examined him. We have also given him IV fluids. Sorry, we have examined him. We have done some investigations to him. One of the investigations was the CT scan. Has anyone told you about the result of CT scan? Actually, I don't have encouraging news. Would you like me to proceed? The CT scan here shows that he is having intra or extradural hemorrhage. Second scenario is pelvic fracture. So the CT scan shows that he is having extradural hemorrhage. Doctor, what is this? You will explain to her that this is a bleeding outside the brain, usually due to rupture of the blood vessel between the brain and the skull. And this happened due to the trauma he had got. Doctor, is he going to die? Now you will tell her that what we have done. Okay, so again, if she tells you, number one, you will break the news in layer. You will break to her that we have done many examinations We have done many examinations. One of them was an investigation. One of them was CT scan. Then bring the result of CT scan in layers. After that, she will tell you, Doctor, is he going to die? Now you will tell her that what we have done. Let me tell you what we have done. Why? Because you are taking marks for the management if you say this. Let me tell you what we have done. Number one, you will say about the primary survey, we have stabilized his oxygen saturation by giving oxygen. We have given him IV fluids to compensate for the blood loss. Doctor, is he going to die? Now you have to tell her that they disclose the thing to her. Actually, team of expert doctors are looking after him. They are preparing him for surgery right now. His condition is serious. So now we are telling her, I'm afraid that his condition is serious. Team of doctors are looking after him right now and they are preparing him for surgery. So see, you disclose to her after the third step. Number one, tell her about the investigations, break the investigation in layer. Okay. Number two, tell her about what we have done in terms of oxygen and IV fluids. Number three, tell her about the team of doctors preparing him for surgery. Which surgery, doctor? It is a surgery which aims at removing the blood from the brain. It's called Withholding craniotomy. Withholding craniotomy. I'm going to write the name for the people who are confused. Withholding craniotomy. Doctor, you are going to drill, or are you going to make a hole in my little one brain? My God, I can't imagine. Just reassure her that they are preparing him by this, or to do this, we are going to put him to sleep, which means that he will feel nothing. Oh, doctor, so are there any complications for it? You will tell her, when someone asks you about complication, please ask about the short-term complications and then the long-term ones. Short-term complications are bleeding again, rebleeding, infection, pain as well. Those are the complications to any major surgery. Rebleeding, infection, and pain. Rebleeding, infection, and pain. Doctor, are there any long-term complications to this? Listen, this is a head injury. So what is the complications to any head injury operation? Number one, he can be left with some weakness problem, like yesterday, if you remember, weakness problem, speech problem, sensation problem, difficulty understanding, difficulty or problem with the behavior, and then offer solutions. Which solution? Physiotherapist, occupational therapist, and speech therapist, as we said. For the movement, we are going to offer physiotherapist. For the speech, we are going to offer speech therapist. And for the social skills like the understanding and behavior problem, we are going to offer occupational therapist. Okay, okay. The outlook of the surgery is good. Surgery itself, the outlook is good. Okay, this is the whole station. So, number one, you will tell her about the investigations. Break the investigations in layer. The result in layer. This is number two. Number three, tell her what we have done, like oxygen, IV fluids, the primary survey. Number four, now we will tell her that he is in serious condition. Team of expert doctors are looking after him to prepare him to surgery. If she asks you, doctor, can I see him right now? I told you that team of doctors are preparing him for surgery. Don't you think it can be a little bit interruptive? Doctor, I need to see him right now. Okay, I will talk to my senior to find out if we can arrange that for you, or to arrange that for you. So at first you will offer her that this is interruptive, but in a nice way. Then you will tell her that seniors, or you and your senior will arrange a meeting for her with him. This is the extradural hemorrhage. Whole craniotomy, I told you the name of the operation, okay? You can also do another operation, but it is an open surgery. The open surgery, in which a portion of the skull will be removed to remove the blood. It will be open, sorry, to remove the blood clot. But you know, whole craniotomy is sort of drilling. Drilling, which means that you will evacuate the blood clot. But in the open surgery, you will open the skull like a window and then remove the blood clot from it and close. Number 2 is a pelvic fracture. Pelvic fracture or pelvic injury. It is similar. Joshua as well had pelvic fracture. The poor guy now is having pelvic fracture, which means that he's having all the serious injuries. So now you will disclose again in layer. Here you will come and you will tell her that actually he has come here and we have done many examinations to him. Which examinations? We have examined every part of him, including his pelvis. Has anyone told you about what we have found in the pelvis? Here the only difference is that the X-ray or the pelvic X-ray is still awaiting. But from the inspection and the examination, you find that there is a pelvic fracture. So you found pelvic fracture, but still you are waiting for the pelvic X-ray. So here you will tell her that, have anyone told you about the examinations? Actually, we have examined his pelvis and we found that there is a big fracture in it. Doctor, fracture? Is he having broken bone? Unfortunately, yes. Oh my God. If she cries again, if she cries at any point, please let her cry. Give her the time to cry and do everything. Why? You are taking marks for it. Actually, some people may consider that she is wasting their time. No, she is not wasting your time, guys. She never wastes your time by doing these things. You are taking very good marks for this in terms of interpersonals. Why the people are marked in data gathering in these situations? Because they do not elaborate the incident very well. For example, she tells them that he had a fall outside the mall. Now ask her, may you know what next, what happened next, and what happened next, and what happened next. Keep asking this question because you are taking marks for your data gathering. But if you stop at she told you or at her telling you that he had a fall, and you supply to it and move to the Breaking Bad news, this is not enough. Because many people may consider that Breaking Bad news are just Breaking Bad news. No, it's normal station. But Breaking Bad news is part of it. Okay? Okay. So, now you will tell her that she will ask you, Doctor, is he going to die? Now you will tell her what we have done. We have number 1, giving him oxygen and IV fluids to compensate for the blood loss. And we have also ordered some X-ray and we are waiting for the results. Is he going to die, doctor? Now you will tell her that his condition is serious and team of doctors are preparing him for surgery. Which surgery in this case? Stabilization of the fracture through external fixation. The aim of surgery is to stabilize the fracture here by applying fixator from outside. Just external fixation. The aim of surgery is to stabilize the fracture. Tell her. And together with stabilizing the fracture, we need to stop the ongoing blood from the injured blood vessel. So the surgery here is to stabilize the fracture, definitive management of the fracture, and as well stopping the bleeding from the blood source. You can ask some history, for example, apart from that, does he have any other medical condition? Does he have any allergy? Like a quick question. Your history here should not take you more than 1.5 minutes. And do not spend too much time in history. So again, you will tell her that we have done this and the examination showed pelvic fracture. Okay, doctor, is he going to die? I can imagine how you are first, or how it can be scary for you, or how it can be tough time for you. However, we are going at this time. Let me tell you first what we have done. We have given him oxygen. We have given him IV fluids to maintain or to compensate the blood loss. And we have ordered some X-rays, which results are awaiting. Doctor, is he going to die? Now we will tell her that his condition is serious and team of doctors are preparing him for surgery. Which surgery? I told you, stabilization of the fracture and stopping the ongoing blood loss. And the surgeon may need also to open the tummy in case of there is any further bleeding in the tummy. because usually pelvic injuries are associated with abdominal injuries as well. Okay, what's next? She will tell you, doctor, can I see him, or are there any complications first? What are the complications? Again, short-term complications and long-term. Short-term are rebleeding, pain, infection, problem with the movement here because he's having a surgery in the pelvis itself. Maybe damage to surrounding structures as well, because there are many blood vessels and nerves in this area. What are the long-term complications? If she asks you about are there any other complications, you will say the long-term complications. Like what? Like prolonged difficulty in movement. Okay, most probably this is the most common complication, and some tingling and numbness. Doctor, how can you deal with that? You will say the physiotherapist again. Physiotherapist can deal with that, and we are going to follow him up to make sure that there is no complications or to minimize the chance of complications. Can I see him? Don't you think it's a bit interruptive? Doctor, I need to see him right now. Okay, you will arrange a meeting with the senior. I mean, you will talk to the senior to find out or to arrange a meeting for her with Joshua before going to the operation. Guys, tell me, anyone here wants to ask anything before I proceed to the next station? Anyone has any question? Please tell me. Anyone has any question before I proceed?
Dr. Ahmed?
Yeah, who is speaking? Oh, it's Rivera. It's Rivera, yes, sir.
Yeah.
Yeah.
Would you please repeat for me 10th times again this the breaking? So first
The breaking what? Your voice is breaking itself.
the breaking bad news. So it's has anyone talked to you? And after let me tell you what we've done, what we have done so far.
Yeah, again.
And,
okay, again. No problem at all. No problem. Let me
yes.
tell you again. Let me tell you the whole thing again.
Yes, please. Yeah.
Okay. So actually, we have done these examinations or investigations or whatever. Has anyone told you about the result?
Okay.
Or do you have any idea what happened, or do you have any idea what is the result? She will tell
Okay.
you, no, doctor. Actually, I don't have encouraging news. What's wrong, doctor? You will tell her that by the examination or with the investigation show that he is having, for example, bleeding on his brain, which we call extradural hemorrhage. So you mentioned what you have done, and then one of the investigations was that. Have anyone told you about the result? Actually, I don't have
Yes.
encouraging news. Would you like me to proceed? Now we will say the whole thing. And I have to tell you one thing, but please, 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 guys, do not rely on it. Do not rely on it because, okay, I'm not discouraging you, but I need all of you to follow their own approach in the Breaking Bad news. What I mean, I will tell you something. I will give you an example. Just let me stop the recording because this recording in layers. So here you have to break the news bad in layers. The task here says that your FY2 working in surgery department, the patient has been admitted 2 days ago after SOL removal operation. Now she has developed some neurological deficit in her right side of the body. She has tingling and numbness and weakness in her right side of the body, for which she has been taken to the CT scan. CT scan has been done, and it showed ischemic stroke. And they have shifted her to the ICU, while the CT scan is waiting for the specialist review. So here you are waiting still for the specialist review. Okay, okay. Special note: the patient has osteoarthritis since 15 years, and she is not so mobile. Okay. So now we will do like this. Hello, by the way, this guy is quite chill. This guy is not like, he's not that broken, but when you disclose the news to him, he'll be broken. So, how is my mother? He will tell him, I'm here to talk to you and address all your concerns. Tell me what happened exactly, or what was the reason of the admission. He would tell you that she was having SOL a few weeks ago. It was discovered by a CT scan, and he will tell you the whole story. And how is it managed, and what were the symptoms then. Now take some medical history. Why you take medical history here? Because actually it is a breaking bad news, but it is like test result. You know, in the test result station, the guy does not know that a bad news are coming. But in the previous stations that we discussed, they already knew that bad news are coming because the condition was pretty serious from the beginning. But here, he doesn't know that his mother developed complication. So you need to take some history from him, and you can be quite chill, like take 3 minutes history from him. And after that, you will tell him, actually, has anyone told you about your mother condition? After the operation, we have found that she developed something we call neurological deficit. Do you know what is this? He will tell you, what is this, doctor? Well, it is some weakness in one side of the body due to some nerve problems. So, well, actually, you have done some investigations for her. One of them was a CT scan. Has anyone told you about the result? Actually, I don't have encouraging news. Would you like me to proceed? Now you can tell him that the CT scan showed that she is having a condition we call ischemic stroke. What is this, doctor? It sounds too scary to me. Is she going to die? May I know why you think so? Guys, tell me, the ischemic stroke kills? Dr. Bina, now it's your turn to answer me. Please, ischemic stroke can kill anyone or not?
It can.
Really? When is this?
It depends on the situation, I guess.
Okay, I have a good idea. If it is, okay, Dr. Zaid says if it's very massive. Yes, it's very massive in the way that she is like, she's gone. But actually what happens is that the ischemic stroke usually is associated with some neurological disabilities, but usually not death. Normally, no.
Okay.
So
Right.
this guy thinks that his mother is going to die. So may I know why you think so? He would tell you, doctor, it sounds too scary to me, doctor. I think she's going to die. May I know why you think so? He would tell you, because the name of the stroke, doctor, I've heard that it kills people. Now you explain the stroke to him. You will say that it is actually disruption in the blood supply to the brain, which leads to some weakness in one side of the body. Okay, doctor, so why did she develop it? It is a complication of surgery. So why didn't you tell me about this, doctor, please? Actually, I have explained this to your mother, I'm sure. Now you will tell him that we have explained the complications to his mother before the operation. Why didn't you explain to me? If he tells you, why didn't you explain to me? Has anyone got any answer to this question? Why didn't you explain to me, not to her? Can anyone answer?
Because we usually explain to the patient while discussing it.
Exactly. Because the patient usually is having mental capacity.
Capacity, yes.
Right or not?
Yes.
Usually we explain to the patients themselves.
Oh.
So what are you going to do right now, doctor? You will tell him that we are waiting for the specialist review. What will be the treatment, doctor? No, wait. When he asks you why did you develop that, you told him it's a complication of surgery. He tells you, doctor, why didn't you explain this to me? You will tell him that we explain to the patient as long as they are mentally competent. So, doctor, you are telling me that she got this because of you guys? Now you are going to tell him that it is a common complication after surgery, which was explained to your mother, and it's more common in case of older people and in major operations like the tumor. No, it is not the same case. It is another one. It's one of the case, or it's a little bit different case here. So, so doctor, how are you going to treat her? Right now, we are waiting for the specialist review. We can't say the treatment because it depends on the site and the size of the stroke, or the extent of the stroke. But what could be the treatment? So he insists on the treatment. You tell him that we are going to give her some blood thinners, not the blood thinner, like not the blood bursting. I mean, you're not going to give her heparin here. Why? Because the chances of, if you give her heparin here, you will turn the ischemic stroke into cerebral hemorrhage. Because after the operation or after major operation, the chance of bleeding are even higher. So you are going to give her blood bursting medication, which is the heparin. This means that you are turning the ischemic stroke to cerebral hemorrhage. So now you are going to give her many blood thinners, like many aspirin, as well, and we are waiting for the specialist review. And regarding the neurologist or the neurological disability, you can provide her with physiotherapy. But doctor, now you told him that the treatment depends on the specialist. Okay, doctor, is it curable? Actually, it is not curable, because once a stroke occurs, actually it can leave some disabilities, especially in the old age people. Okay, so most of the strokes are having good prognosis, but in this case, it's not curable. Why? Because of the age of the patient, because of the operation, and it also depends on the limit or the extent of the stroke. If he asks you what could be the complications, again, you will tell him it depends on the site and the extent. If he asks again what is the complications, you will tell him normal neurological complications we have been discussing many times before. Weakness problem, sensation problem, speech problem, understanding and behavior problem, and fits sometimes, like any neurological station. So again, the core of this station is that you do not know the treatment, you do not know the complications, and you do not know the prognosis because you are still waiting for the specialist review. And here the stroke was the complication after the SOL removal because it's common in old age patients, and especially if the patients are not so mobile, like because she's having osteoarthritis. And you're going to break it in layers. Very important. Okay, okay. This station is a little bit tricky. Okay, why tricky? Because not all the people know about it, but it's very easy. Okay. The problem here is that some people do one mistake. Which mistake? I told you that my friend, you know what did he do? He actually what happened, this could be fine. No, this is not fine. This can happen to anyone. I will tell you what happened. He entered the cubicle and he started talking to the relative, and guess what? Suddenly what happened is that when he came to disclosing the layer or disclosing the news, he told him that I cannot tell you because your mother has not given us the consent. So the relative was shocked. Doctor, please tell me. He told me that the simulator was smiling. And the examiner told him, Doctor, please read your task again. Okay. If the patient is unconscious, actually here you can conclude that the patient is not conscious. And actually this is what happens. The patient is unconscious in this task. She's unconscious after the operation. So what happens is that you can tell the relative. That's why the examiner told him, read your task again. If you find the word unconscious, you will get to know that you can talk to the relative. Okay? No need to tell you about the consent. GMC are not stupid to forget these things. They are very aware about what they are doing. That's why it is a trick. Some people may try to be smart and say that there is no consent. No. You can disclose in this station to the relative. Okay? That's why you know the examiner kept. How affect the examiner its assessment, doctor? Tell me. Definitely. Definitely. He didn't pass this station. He didn't pass this station at all. He didn't pass this station. Because of this. because the examiner was trying to help him. The examiner told him, "Doctor, read your task again." He told him twice. So, this is what happens. Please, guys, again, if someone is unconscious, make sure that you can disclose. The only station in PLAB 2 so far in which you cannot disclose is the station of the angry son, the angry consultant son. Of course, beside the OCP's station, and what else? And confidentiality, other confidentiality stations. Any confidentiality station like the OCPs, as I told you, now you cannot disclose. But in the case of other stations, all the other stations you can disclose to the patient or to the relative normally. Okay. Has anyone got any questions so far regarding the breaking bad use? I need to clear any doubts regarding the breaking bad use before moving to the other stations, because the other stations are easy. Has anyone got any question? Because I really, guys, you need to practice it definitely, and that's why I'm going to practice it right now with one of you. Someone can volunteer. Dr. Elvira, can you volunteer? Or we can do it after the session, if you wish. Do it now. Dr. Elvira, you can volunteer right now.
Oh, hello?
Hello, Dr. Elvira.
Yes, hello, 1 sec.
Okay, no problem. Take your time.
Um, 1 second. I'm trying to open it. 1 sec.
No problem. Take your time.
It says it's giving me only 3 options. It's giving me raise your hand, mute your audio, and rename it.
Okay, I have a good idea. Why don't you ask me to open the video for you?
Yes, please.
I think I'm the admin of this group. I was trying to see if you are going to open it. Okay, wait. I think you can start it right now. You can start it right now. Yeah.
Yes.
Hello. How are you?
1 second. Let me go back.
Can you see me right now? Or my video is frozen? Oh, it's frozen. Oh, yes, okay, I have a good idea. If Dr. Zaid and Dr. Elvira is fine, I'm going to observe you guys. Dr. Zaid, you can volunteer and I'm going to observe. I'm not going to press, if you wish. Dr. Zaid, volunteer. I need Dr. Zaid to be the doctor here, and Dr. Elvira will be simulator. And after the session, I will be the simulator to Dr. Elvira. Okay, so now you are the simulator to Dr. Zaid, Dr. Elvira. Your voice is not clear. You are muted. You are muted.
No, I'm not muted, but
okay.
I'm waiting for Dr. Elvira.
I am.
I'm
here. I'm here for you, Zaid.
Hi, how are you?
Thank you. Thank you very much. I just don't see no unit myself. I don't know what's going on with this thing.
No, it's fine. It's fine.
Is it fine?
Yeah.
I wanted him to see how I cry.
No, we can see you. We can see you.
Really?
Yeah.
All this time?
Yes, all this time.
My God!
We can see you. No worries.
It's
Don't
not
worry.
fair.
No, it's fair.
Okay.
Don't worry. Don't worry. We're here one family
Okay.
together, aren't we? Aren't we, Dr. Masi?
Marcy, do you see me?
Yeah. Yeah, we see you.
Okay.
Okay, let me
Okay, then.
start. Let me start to save your time.
I have timer.
Okay, no. First, you have to know the task. You have to know the task. Your
Yeah.
FY2
Okay, task.
working. Yeah, your FY2. Okay, Dr. Elvira, concentrate. Your FY2 working in A&E. The patient.
Me?
No. Zaid is the FY2.
Yeah, me.
Okay. You are FY2 working in A&E department. The patient is 75 years old, the male patient, presented with severe headache. CT scan has been done. He has been brought to the hospital by the ambulance. CT scan has been done, and it showed rupture aneurysm and bleeding on surface of the brain. The MDT,
I miss you, Sally.
yeah, exactly. And the MDT have examined him and decided that the surgery is not appropriate due to his condition and due to his age. And shifting to the ICU is not appropriate as well because of his age and because of he is unconscious and breathing on his own. And DNAR has been decided to be inappropriate as well. Only palliative care has been decided to be appropriate.
Okay.
Talk to the patient and address his concern. Talk to the relative and address her concern.
Okay. But why
So,
I can't see anyone? What's the reason?
yeah,
Hypertension.
No. I don't have a hypertension. I'm talking about my camera. Why I can't see anyone?
yeah, because when you speak, can you see me right now?
No. You can see.
No.
Maybe you're using mobile, Dr. Ilfa. You're using mobile.
What?
You are using mobile. Mobile,
Yes.
right? Oh,
Yes.
sometimes it stops with the mobile. I will tell you why. Wait.
Oh my God! I was staring at the wrong screen.
Oh my God.
My God.
You are not fine today, Dr. Elvira. Something is wrong.
Sorry.
It's fine. Okay, let's start.
Sorry. Okay then. Yeah. Okay.
Let's start. I'm going to set the timer for you. Dr. Zaid, are you ready?
Yes, I'm ready.
Okay,
I will
start.
speak with you first as examiner. Okay, yes.
Yeah. Okay, I'm the examiner. Okay.
Yeah.
Start. Wait. I'm just raising the voice, raising the volume. I think something is wrong with my. Oh my God.
Yeah, I can start my timer from here. Yeah.
Okay, start from you. I think something is wrong with my timer.
Hello, examiner. This is my ID.
Okay, proceed, doctor.
Hello, good morning. My name is Dr. Hamdani.
Dr. Zaid, stop your timer. Stop your time. I don't like good morning. I seriously have problem with it. You better say hello.
Right.
Okay.
Okay, I'll start.
Yeah. Because your exam actually can be in the afternoon batch.
Yeah.
Okay, so better don't say that. Okay. Don't get used to it. Start.
Okay. So, hello, Miss Ali. I am Dr. Hamadani, one of the junior doctor here in the IND department. May I confirm your name and age?
Your voice is not okay. Wait. I think you are muted, Dr. Elvira. You are muted, Dr. Elvira.
Yes.
Yeah, it's fine. Speak again.
Sorry.
Speak again. No problem.
My name is Mrs. Maria Ali. Yeah, doctor. What is my husband? What is he doing? How's he doing?
He is in good hand. May I ask you?
Please tell me what's going on.
I can see you.
Oh my God! Please tell me. Is he all right?
Well, he is in good hand right now. May I ask you some question regarding his condition?
Yes, of course. Yeah. Do ask me.
Can you tell me, please, what's happened to him?
Well, we were just sitting and watching TV, and I just don't know. He suddenly was sitting and he just started to fall on his side, and that's it. I couldn't get anything from him. I kept screaming, Mahmoud, how are you? What are you doing? But he wouldn't answer to me, and I called the ambulance, and I just straight away I came here. Is he going to die? Just tell me that he's fine, doctor.
Well, that's a good thing that you brought him to call the ambulance. And did you know what happened afterward?
What do you mean, after all?
How much do you know about his condition, I meant?
I don't know. I thought that you will tell me something.
Yeah, I'm
You're
going
asking me? We're asking me?
No, I'm not asking you. I want to ask you more. I want to know how much information you know about his condition so far. I'm sorry you are worried about him. Yeah, I can see you are very worried about him.
You mean right now? What is going on right now? I don't know anything what is going on. You tell me what is going on.
Well, yeah, I'm going to.
You find it funny. You think it's funny, doctor. Who are you? Yeah, I want another doctor. Please go back and send me another doctor.
I'm sorry, I didn't mean that. I'm sorry, I didn't mean that. Yeah, and actually, I'm really sorry.
You can't imagine what am I going through, sir, at this moment.
I'm sorry. Can I ask you more question about his condition? I'm sorry, about his your husband in general. Does your husband have any medical problem?
Yes, unfortunately, Mahmoud had quite high blood pressure, but he was taking medications for them. I was making sure that he takes them on time, and I was cooking him very nice and good meals. I was making sure that he eats healthy. And what's happening now?
Yes. Okay. Well, when we brought him here to the hospital, actually, we did examine him, and we did wait for him several blood tests and scanning.
Yes.
And
yes.
So, would you like to know what we would done for him? So, what was
of course, I would like to know. Yes, yes, please. Yeah.
Well, we did for him CT scan, and do you feel would you like to continue? Would you like me to continue about that? To tell you the information?
Yes, please continue.
Well, I'm afraid that I don't have good news regarding the result of CT scan.
What do you mean by the no good news? What do you mean good news? Bad news? Is it bad news?
Well,
is it not good, or is it bad news? Is he dead?
Well, unfortunately, we found that he has bleeding in his brain.
Stop laughing! You make me laughing. I'm trying to cry here.
Guys, do not spoil it. Keep going.
Exactly. But his eyes keep smiling and make me
keep going. Keep going, Vera. Keep going, please.
Okay. That's it.
Yeah.
Okay. Yeah. Okay, Zaid, continue where you stopped with the CT scan.
Unfortunately, we found CT scan showed that he has bleeding in his brain.
Okay, yeah. And what does that mean?
Yeah. Well, the problem that he got bleeding because of rupture aneurysm, perianeurysm.
Okay. Is there anything that you can do for him, doctor? Please do something. We were married for 50 years.
Yeah, I can understand you are really worried about him. You have all the right for that. It is really in a bad situation right now. I'm sorry to say that for you, but yeah, and actually a team of expert surgeons. And
did you do anything else apart from the CT scan, doctor?
Well, at the moment we are preparing him for the surgery.
Okay. Can you talk to me? Can I go and talk to him a bit, please?
Well, right now he's with a team of expert people. And
I will be very quiet. I just want to have a few words with you.
Yeah, for sure, I can arrange that for you. Anything else?
Yes. Then I'll go and have a chat with him. Yeah.
You want to have a chat because he's right now his condition is unconscious.
Well, you just said that I can go and have a chat with him. Okay, tell me what else you can do, doctor. Please tell me. What are the team of doctors? What are they going to do?
Well, a team of doctors examine him, and as I told you that he has massive bleeding in his brain, and unfortunately his condition is really bad.
Really bad.
Right.
Oh my God, what I'm gonna do? What I'm gonna do? Shall I call my daughter? She lives in Australia.
Well, yes, you can call your daughter. Yeah. I'm really sorry for delivering this bad news for you.
Shall I tell her to buy a black dress? I'm joking. You have to keep saying me. You have to. I'm crying. Please specify me.
Oh, I'm sorry for that. I can imagine how you feel right now. So I can give you some. Do you feel all right?
No.
Do you want me to call anybody
I'm
for
really
you?
distressed. Yes, please. Yes, please.
Yes.
Call my daughter. I need her at this moment. I don't know really. He's going to go into operation. What happens with that operation? Is there any complications there?
Well, yes. Well, as I told you, that his condition is really in a critical situation, and the complication might happen because of that. Yeah.
You said that he is very bad. Are you still going to operate him?
Well, actually, the team of surgeons and the MDT team, they decide regarding his condition that it's difficult for him to do the operation for him.
Why they
enough.
change their
Enough.
mind? Why they change their mind?
No, guys. No, Elvira. No, please.
Okay, we shouldn't be doing. Yes,
Yeah,
you're right. I'm
This
sorry.
is this is unfair. This is unfair to him. Seriously.
Yes, yeah. I'm joking. Yeah, because in a scenario it goes there that he changed. No, that they are not doing the operation. As far as I remember from how we were practicing it.
No, Dr. Rivera, you have to train yourself on accommodating and following any candid answer.
Okay.
Like, for example,
I was not doing.
Yeah. For example,
but when we were practicing there, the teachers, they were how I would say, they were practicing with us, and they were practicing in this way that to sort of prepare us that the patients might be quite nasty, and sort of to be ready for that.
Okay, I have to tell you something, Dr. Zaid. Let me point out the mistakes that you have made in this station. I repeat it with you again. Don't worry. I repeat, but not now. I repeat.
I'm sorry. I think. Yeah. Are you upset at me?
No.
No.
No, don't worry. Actually, I did a very good job in terms of acting and simulating release.
No, I tried to show that I was trying to show him that he could pick up the clues that I was actually distraught, and I was very, very upset and sad, and
actually
he had to say me.
You did a very good job. I believe you did very good.
He had to say me sort of, is there anything I can do for you? Would you like a t-shirt, please? I was almost crying, I think, there at some point.
Okay, Elvira,
I don't know.
Elvira, let me point out the mistakes so that to save the time, because we still have to speak about some other things as well. Okay, Dr. Zaid, I have made some remarks on your performance here. You really, I'm sorry to I have to be honest. Your problem in the Breaking Bad news is that you are very anxious. Dr. Zaid, tell me honestly, are you anxious in nature? So anxious, like stressed?
Yes, sometimes, yes.
Not sometimes, I mean like an anxiety disorder or something?
Yeah. I'm an excited person, yes.
Yeah. This what happened because you started stammering after introducing yourself, and when you came to the critical point or the serious point of the station, you started stammering too much. Stammering, like for example, you were like bringing a word from here and there, and you were not even accurate about what you say. You were saying many wrong information actually, and when it came to the surgery, you were not clear. Why will you do surgery, Dr. Zaid?
Well, like I get confused with the other case actually. Yes, yeah.
In no case you can do surgery, Dr. Zaid. In Breaking Bad news, usually the patient is in the stage, so the patient will not undergo any surgery. No Breaking Bad news will be having surgery, Dr. Zaid. This is what we have been stressing on. Please do not always forget that, because if you say that, the examiner will shout at you, "Doctor, look at your task again." And by the way, they will mark you down. They will mark you down if you say this. Don't be happy if they tell you this. because this means that you did not read your test properly, or you are scripted.
Yeah.
You were smiling, I don't know why. Actually, you know very well that the patient is even worse than Dr. Elvira. She's giving you more
Yes,
tough
you
time.
know that. Please don't tell me off. He started first. He started laughing and
Yeah.
smiling. That's why I've gone.
Yeah, sure.
I just couldn't keep myself. I was crying and he was smiling.
Yeah, that is a good point actually. But you know, Dr. Elvira, you shouldn't have commented on it. You should let me mark him down because you give him the chance
No,
to
I
correct
didn't want
himself.
him. I wanted him to pick up from there. We're practicing. My poor son is walking into the room, looking at me with anxious eyes.
No. I have to tell you something.
Yeah.
Dr. Zaid, if you
Yes,
smile in the
yes.
Breaking Bad news under any condition, you're going to
Yes,
fail it.
unfortunately, yeah.
No.
Yeah.
You're going seriously to fail. This is unprofessional. This is unprofessional, seriously. If you smile to a patient who is having bereavement. No surgery, Dr. Fumzi. Oh, yes, with Joshua. You mean with Joshua. I'm sorry, I didn't read this message. Yeah, with Joshua. But, you know, I have a good point to make to you guys. In Joshua, we tell the parents that his condition is serious. Do you know the difference between serious and terminal?
Of course, serious, there is some chance.
Some hope. Yeah.
Yes, and some hope that he can make it with some miracle. But terminal means terminal, caputo, finita.
Exactly.
He's there. Yeah. La commedia. Yeah.
You speak Italian as well. Okay.
Oh.
Yes. So the thing is that in the serious condition like Joshua, you are actually going to do surgery. But here the task tells you, Dr. Zaid, that the surgery has been decided to be inappropriate. Do you know the difference? So this is the number two as well. You are stammering. I told you that you are stammering too much, Dr. Zaid. Too much. Actually, in this station in particular, you are not supposed to speak too much. Why? To stammer too much. Because you are having all the findings in your task. The task here contains everything, Dr. Zaid. Everything more than you can imagine. So why do we need to stammer here? You have everything. And by the way, if you are stammering or if you are confused at any point, excuse yourself from the patient and have a look at your notes. Back again, the task. Okay, Dr. Zaid? Do not ever lose this chance. If you have a task to put to look at it back, it's never too late. But the late thing, Dr. Zaid, is that you always speak wrong things without making sure that they are the things to be said to the patient. Dr. Zaid, let me point out two more things as well. You were lacking facial expressions. You were lacking facial expressions and sympathy and empathy. I was thinking that you are talking to someone who's receiving his blood test result for anemia. You were so chill when you are disclosing the news. It was about like, yes, it was like about you are telling him that you are having some sort of flu or some sort of anemia. No, I need you to be a little bit expressive, and that's why I wanted to show you how to react in it. I will practice with you guys after the session directly in the Breaking Bad news, and please, I know that many people want to practice it, but no use of practicing it in a wrong way. So I need all of you to learn how to practice it in the right way, and after practicing it, all of you can practice it with each other, okay? I don't mind wasting at least 1.5 hours in the Breaking Bad news stations because when it comes, most of the people fail it. Why? I bet now you know why, Dr. Zaid. Leave this station to me in the end, okay? I will discuss it. And by the way, Dr. Elvira will be my simulator, no matter how she wants to sleep, no matter how her kids are around her. I don't care. She will practice it with me. Okay? No, it will not affect your mark, Dr. Islam. But in the Breaking Bad news, it's advisable not to do it. Because, you know, you are living in the atmosphere. I mean, you are going to take the mood off or to be off the mood for a few seconds. It's not good for you. Not good to lose track in the Breaking Bad news. Nor in the angry patient. Yeah.
Can you be a doctor? Because I want to see how it has to be done in the right way. Because unfortunately, when we were doing it in the academies, we had the different teachers, and to be honest, truly, they had a very different approaches. And
Very good. This is very good. This is very good.
Yeah,
That's
so
what
I
I
wanted
wanted
just
from
to
you.
see how it should be done.
Okay.
Yeah, thank you.
This is what I wanted to do with you actually, but Dr. Zaid wanted to practice, so I can't say no actually. If someone wants to practice, always everyone is welcome. But what I recommend, guys, is that you first you see the right way of practice, and after that you will follow. And this is my mission, and that's why I have specified for all of you 1 hour after the session, the course, after we are done with the course, to just see how to practice in the right way. After that, I'm sure you can go. Because what people are lacking, I tell you what you are lacking, guys. You go to the academy, you prepare the notes, you read everything, you become perfect plabber. Then, with the first practice, you start see, you start stammering, you start losing track, and you start losing many things, including your communication skills and your own self. Is this fair? No. Today I was asked by many recent plabbers, like, doctor, we need the materials, we need the materials. See, they are repeating the same mistake. They are repeating the same mistakes that we have done in the past, only caring about the materials, only caring about the notes which change every other day, and the guidelines which change every other day. But one thing will not ever change. One thing will never change. You know which one thing? Your skills. If you are able to tackle, I told you, you can imagine, my first station in PLAB 2 was the sick note, in which actually she's the worst, not worst in bad way, worst, like she's a very good actress. She's actually crying, she's knocking the ground. And I was very calm. She was looking at me in a way like, you are very cold. She was looking to me like this. I was not stammering, I was insisting, and I scored high in it. Sorry, I passed it, but I didn't score high, and I never saw anyone who scored high in it, but I passed it anyway. So what I'm telling you, that it's always about your calm and confidence. It's not about what you read in the script nor what you read in the notes. These findings can change at any time. I was entering the Breaking Bad news and I knew that this guy is having bleeding in the brain. But I was like, oh, he's having ruptured brain aneurysm and I'm going to enter. Suddenly, out of sudden, praise be to God, praise be to God again, I noticed by chance that he's having intracerebral hemorrhage, not ruptured brain aneurysm, because this is what happens when you are sure about the task without reading it. So please read the task again and again and again, and notice it. They are changing the findings too frequently, but they are always around the same way. They are around the same point. Dr. Maria, you will see it soon. You will see it very soon at the end of the session. I just hope you are still awake and you not sleep like the other people who tell me, Dr. Ahmed, I'm going to sleep. Dr. Ahmed, I'm going to sleep. Okay. So, we will practice it, Dr. Zaid. Don't be discouraged. Don't be disheartened by that. You are on the right track. You can't sleep, Dr. Maya. I know that it's your result today and you cannot sleep today. And you will not be sleeping from today because you are preparing for PLAB 2. So let's move to the next stations because we are still left with many stations. I think we'll not be having time to discuss all psychiatry. We'll discuss only 3 of them maybe. But it's fine. I'll pick up the suicidal attempt and one of the delusion state or delusion case. I have some update about this case actually. We have to correct ourselves because I have seen that many patients, many people actually, they have been losing marks in it just because of one thing, because they say delusional disorder. So I don't know, they have been marked in the diagnosis many times. That's why I believe that there could be some problem with this station. Okay, okay. So let's move to the next station. Wait, guys. Okay. One of the interesting stations, it's not that interesting actually. It is one of the worst stations because the guy does not want to take warfarin and he believes that it is a rat poison. Okay. He believes that it's rat poison and still you have to convince him to take warfarin. Very interesting. This guy is going to give you a very tough time. He is stubborn. He never listens to you. He never does anything. So what I can do here, okay. I told you before, when someone is reluctant in PLAB 2, I mean someone is not convinced. Okay, I'm saying that someone is not reluctant someone who is not convinced, not someone is reluctant to open up. No, he's here not convinced. What you can do with someone who is not convinced, like the Kenya stations, Dr. Yasmin. Dr. Yasmin.
Yes, I will ask, may I know why you don't want to accept it? May I know the
Perfect.
reason
Perfect. He
why?
will tell you, doctor, it is a rat poison. I don't want to take it.
Hello?
Yeah, I don't want to take it, doctor. It's a rat poison.
Yeah, Mr. John, may I know why you are telling this? Hello?
Yeah, tell me.
Okay. Yeah,
May I know
I'm
why?
asking the question.
Oh, sorry, your voice is
May I?
breaking. Sorry. Say again.
Oh, you're not getting my voice. Okay.
Yeah, say again.
May I know, Mr. John, why you have this video?
Okay, doctor, because it's rat poison, doctor. I have heard that it's rat poison.
Can you please share me what is your experience about this?
Doctor, I have read about it that it was one rat poison in the past.
Okay. And is this your personal? Is there any personal experience, or just you read through?
I read about it only.
Okay. Okay. So I will tell you that yeah, there might be some fraction of truth in this, but by giving this medicine to you, we will be keep watching about your levels and effect of this medicine. Are you with me, Mr. John?
Okay, doctor. But now, actually, you have done the right thing. But what's next, Doctor Yasmin? I need to focus more on the important thing, which is you address his concern regarding it was a fraction of truth in the past. But he needs to take it. You know why?
Yes. Do you have any idea what is the importance of taking this medicine, Mr. John?
Doctor, I know that it prevents a blood clot, but I'm afraid that it will cause me bleeding like my father had.
Okay. May I know for what reason your father was taking this medicine?
He was having some bleeding, some clot in his brain.
Mm-hmm. And other than this medicine, what else he was taking?
He was only taking that.
This medicine. Okay. How do you know that this medicine was causing the bleeding to him?
Doctor, because I know that it's one of side effects of this medicine. I don't want this to happen to me.
Actually, Mr. John, I'm really sorry for your father's experience, but at this moment, I don't know what actually the root cause would be. But for your case, I must say that we'll be giving this medicine and keep observing the readings on a regular basis. We'll keep
Okay,
watching.
doctor, I don't want to take it.
May I know, is there any
I
other?
don't want doctor to have this side effect. This side effect can happen at any point. I don't want to have it, please. I don't care if you follow me. I don't care of those things. I just don't want this bleeding to happen to me at any point.
And do you have any idea that if you will not take this medicine, what complication you could get?
Yeah, this is the important part. So now the patient will tell you what will happen, doctor.
Yes, as you know that you have developed this problem, which is known as like emboli or clots in your vessels supplying to the brain.
Yeah.
When you will not take the treatment, that clot can obstruct the blood flow to your brain, which may lead to a stroke. Are you getting the point, Mr. John?
Yeah, okay.
Okay. Yeah, for that reason, I would encourage you to follow our instructions and take the medicine. And we will keep watching, and you will be regularly coming to the warfarin clinic. So then I will give all the instructions.
Okay, thank you, Dr. Yasmin. Thank you. You did the right thing here. I just need to point out two things quickly in this station. Your performance, I mean, it's just a mini practice here. You were very good. I just needed to assess. Remember, Dr. Zaid, it is called carrot and stick approach, right, Dr. Zaid? What does this mean? It means that if someone is not convinced with something, number one, You address their concern. For example, why don't you want to take it? Number 2, you explain the benefits of taking it. Number 3, you will explain the complications which can happen if he does not take it ever. So number 1, a concern. Number 2, benefits of taking it. Number 3, complications, right? Okay, let's speak about this station in details, and I will point out some few things for Dr. Yasmin, which was pretty good here. 1, you will enter the station, you will tell him he is coming for the review. He's discharged and he does not want to take the warfarin which was prescribed to him. So your mission here is to convince him to take warfarin. He will start taking history. Why were you admitted? And how are you, number 1, why were you admitted? Reason for admission. Number 2, again, current history. Number 3, past medical history or general medical history. Number 4, lifestyle. Number 5, examine. Number 6, move to the management. So he will tell you, doctor, I don't want to take it. May I know why? It's rat poison. May I know why you think so? Because I have read about it on the internet. May I know what you have read? I have read that it's rat poison, it was used as rat poison in the past and this and that. As Dr. Yasmin definitely said, it could be a fraction or a part of truth. However, I want to add something to you. I could better say, personally, I could say that this could be a part of the truth. But most of the medications have been prepared from such components before. Like most of our medications are prepared or are having some chemical preparations in them. So being used as rat poison in the past does not mean that it was something bad. So may I know why you don't want to take it? He will tell you now, he will open up to you and he will tell you, doctor, I don't want to take it because it has caused bleeding to my father and my father died because of it. I'm so sorry for your loss. May I know what happened to your father? He would tell you, doctor, he has slipped. He fell on the ground, he had bleeding in his brain and he died. I'm so sorry again. So that's why you're bored and you don't want to take it. Yes, doctor, I don't want to take it because of this. I'm glad that you shared your concern with me. We are going definitely to work on that. But Mr. John, why we are going to give it to you? Now you explain that we are going to give it to him to prevent the further blood clot. Why? Why? From the history, you could pick up that this guy is having 2 strokes in the past, 2 cerebral strokes, and he's having AF. So we are going to give it to him because one of the complications of the AF is formation of strokes. So to prevent strokes, we need to give it to him. Also, he was having hypertension as well, high likely to develop stroke. Doctor, but I don't want to take it. Still, he's reluctant. Now you can explain the complications. I'm afraid that if we do not give it to you, you're more likely to develop one of the complications, which is a stroke. And the stroke is always having some implications in the people's lives. Like, for example, they can be left with some disability and some other effects in their personality and behavior. And some people can be restricted or can be immobile and restricted to a wheelchair. And I'm sure you don't want this to happen to you. So benefits, number 2, complications. Complications of not taking warfarin are further strokes, which can lead to permanent disability. What about the bleeding, doctor? Well, I'm sure you agree with me that here, after explaining that to you, I'm sure you agree with me that here, the advantages of taking outweigh the disadvantages. So now you will tell him that the advantages of taking warfarin, which are protection from stroke and such things, outweigh the disadvantage, which is a possible bleeding. And even the bleeding, we can monitor it regularly. How, doctor? We're going to monitor your INR and how long it takes your blood to be thin, how long it takes your blood to clot. Okay, and we're going to warn you about that. For example, if you're involved in any accident, or if you are having like major bleeding, or if you're having a bad headache, you can definitely come back to the A&E in a few minutes. Sometimes, some few times, he still cannot be convinced. Usually he is convinced, but I mean, I've been told by some people that still he cannot be convinced. Why? Can anyone guess why the patient is not convinced? In many cases, he cannot be convinced, by the way. I have been told by someone recently that she did not pass this station, though she did everything. And by the way, she got 0 in it. Can you imagine? 0 is very tough. 0 in the total. So can you imagine why? Or can anyone guess why to avoid this mistake in the future? Okay. He was not convinced, Dr. Mahdi. Yes. He was not convinced for many reasons. That's pretty good. You would 7 means that you almost passed it. Yes, yes, you passed it. You know what? He is not convinced in many cases, or he can tell you in the end, okay, I will give it a thought. Don't worry if he tells you this. But if he is not convinced, or if he is not convinced, or if you feel this station, this means that you did not warn him about the complications of it. You did not scare him enough. Because when you speak about the benefits, okay, he will accept it, but he will not be convinced. So here you have to mention about the complications. And you have to warn him about side effects and how to tackle it. If you did not warn side effects, you may not pass the station, because this is his main concern. So you have to tell him, if you develop any severe bleeding or any severe headache, come back to us. If you do not do this, you will be marked down in the management. I'm sure that he will barely give you 1 or 2 in the management. And in the interpersonals, you have to be very good to this guy. I think he was angry, right, Dr. Mahdi? Can anyone? Yes, so he was angry. So when someone is angry, guys, you have to be very nice. You do not debate the patient. Yeah, perfect. You let him talk to. I think that's why you pass. Even if you are lacking information in this station, you still need to let him speak too much. Okay, so this station so far is quite challenging in terms of you have to follow this approach. Benefits, complications. Benefits, complications. Okay, and in the end, you will tell him that the advantages outweigh the disadvantages. Okay. Anyone has any question regarding this session so far? Because I need to be a little bit faster here. Dr. Masih, are you coping today? Okay, he didn't agree to take. It's fine. You know, I told you, if someone is not agreeing on something, guys, what you do? What you do, guys? What you do if someone is not convinced? Yeah, perfect, Dr. Muniba. I will arrange for you a meeting with my senior. I'm going to arrange for you a meeting with my senior to talk to you about that. At least mention it, so that you'll be sure that at least someone else is going to talk to him. Okay. No, you can mention it. It's always good to mention actually your senior. It's always good. Okay. Okay. So let's move to the next station. Next station is mental capacity station. By the way, this was one of the mental capacity in the warfarin. Why mental capacity? I consider it mental capacity because you are warning the patient about how the benefits and about the complications. For example, do you know why we prescribe it for you? Do you know the importance of this drug? Dr. Masih, it's always good if you keep your voice low. I mean, for example, don't tell him that you should take it because it's having many important things. You know, for example, you should take it because it prevents against the blood clot. No, it's like this. Do you know why you should take it? Actually, we prescribe it for our patients to prevent from further blood clots. Like this. By the way, in my old stations, I used to keep my voice on the lower side. except only for some few stations, the counseling stations, in which you can actually talk to the patient very freely and very nicely. Okay. Next station is the mental capacity station as well.
Hello, Dr. Ahmad.
Yeah.
Hello.
Yeah.
By the end of all trial, if the patient still says, no, I would not take it. So finally, should I say that, okay, it's up to you, it's your decision. Like, then we leave the last sentence like that, or just be silent?
You can tell him that I can arrange for you a meeting with my senior to talk to you if you wish.
Okay. Yeah,
that's what I've been saying. But if he says no senior or something, you can say, of course, the decision is up to you in the end of the day, but we are definitely advising you for your health. I'm sure you do not want, I do not want you to have further stroke and with permanent disability.
I think we have to we have to just respect his decision. Because he has every right to refuse the treatment.
Yeah, sure.
He's mentally able, and we say, unfortunately, I'm sorry that I was unable to explain you all the complications. But if you don't want to take it, it's entirely up to you, and I respect your decision. However, if you change your mind at any time, or if you want to have a chat with my consultant, I can arrange that for you. Does that sound good?
Yeah. This is a good point, actually, Dr. Rivera. But I have one point. Dr. Mahdi, tell me, by the way, I forgot to ask you. Dr. Mahdi, did you tell him that you will end up having a permanent disability? Like you will be, some people can be left with a disability and attending, or like be restricted to a wheelchair? Did you tell him about this?
No, I didn't.
Yeah, that's what I expected. Because why? Because actually most of the people, when you are telling anyone on earth, if you are telling the people or the patient that they are going to be limited to a wheelchair, definitely they will be afraid. They will be frightened.
Okay. I told him only to it could be leading to stroke.
Your voice is far.
Okay. I told him that he might have stroke in future or heart attack in future. Something from renal failure in future. I told him that this. Not renal failure, heart failure, heart attack and stroke. Only two. I scared him by telling this to him.
Okay. Dr. Mahdi, I need to tell you one thing. It's very important here to mention in the end about the wheelchair and the permanent disability, because sometimes he may only accept after these two things. Okay. Can you imagine?
Yes.
For example, let me point out an example. God forbid, if I tell you, Dr. Mahdi, there are some complications and 1, 2, 3, 4, you are still not convincing. But I'm afraid, Dr. Mahdi, that one of these complications can damage your life and can leave you with permanent disability, especially if you already had 2 previous strokes. If you are the same person, definitely you will accept it. If you are having something wrong with your mind, okay, what shall I do? Okay, so at least your final option or your final resort is to mention about this point, the wheelchair disability. Yeah, this is really scary to anyone. And by the way, I bet that most of the people who did not pass this station, he did not mention about the ultimate thing, which is the wheelchair thing.
Okay, so I should mention the wheelchair or permanent disability.
Exactly, you have to.
Okay, in the next time, hopefully I will get this station.
Huh? Excuse me?
In my next time, hopefully I will get this station. And I will say,
you will. I'm sure you will pass it.
Inshallah.
Okay? Okay. Who here is having a question regarding the bus station or any stations we discussed so far? Has anyone got any question?
So, Dr. Ahmad, I didn't start from the beginning because I thought you just put a single question, like in that kind of situation, what the sentence you will say. So that's why I just started with the middle of the presentation.
No problem.
Yeah,
That's why I wanted. No.
I thought you are asking only the why question. And that's why I didn't go beyond like to take history first and then.
No. I know. By the way, I told you it's a mini practice. because I just
Yeah.
needed you to see how you will elaborate the mental capacity thing here. But you
Yeah.
did it good. Mental capacity generally is exactly number one, ask why you think so. Number two,
Yes.
discuss the concern. Number three, explain the benefits. Number four, explain the complications. And all the
Yeah.
things will be, I will, in the mental capacity and the breaking bad news and the angry patient, okay, I will provide them to you, inshallah, in short notes. That's what I told you.
Yeah.
And I
No,
hope.
definitely I am learning a lot, and I believe I have improved a lot. Still
Alhamdulillah.
like working on that, but alhamdulillah, after your guideline, I am improving to low down my voice and like tone. Otherwise, these things I used to say, but in a bolder way, as I am. But
No,
now,
don't say so. Dr. Yasmin, actually, Dr. Yasmin, every day you experience or every day you spend practicing, you're improving. That's what I
yeah,
believe.
definitely,
I mean, I was
definitely.
improving even till the day before my exam. The improvement is endless. So do
Yeah,
not
because
understand.
these things were not taught to us from our academy, so that's why like no one corrected, even though we did practice somehow or not. But these points were not elaborated. I believe like Elvira is also from my academy, so she must be accepting this point that no one has corrected or told us that you should like be tone. Overall, everyone did correction of my confidence level, over knowledge, over qualification, boldness, and bossiness in my personality. But for the tone, volume, and then like facial expression changes, this matters a lot. This matters.
Exactly.
Yeah, now because your voice should match with your facial expression.
Exactly.
Even though we are acting, we are doing performances here, everyone knows we are also performing, but if they expect how your voice should match with facial expression. For example, making some wrinkles, like little bit facial, like you are sad or sorrow, instead of backing with the back, sitting with the back and saying this sentence. It will
Yeah.
not be effective. So I got now. Thank you so much.
Hopefully you will tackle it this time and you will ace it, inshallah.
Inshallah.
So let's move to the next station, another mental capacity station, but this is a challenging station.
Hello, I have one. I want to kill you 30 seconds.
Yeah, sure.
Can I?
Yeah.
Okay. If I tell my patient that his life could be limited to wheelchair or he could have some permanent disability, even after telling that, I hope that he will convince. But even after he will not convince, should I offer my senior?
Yeah, you still can arrange a
Oh,
meet. You just, if you still have any problem or any doubt, I can arrange for your meeting with my senior, if you wish, like this,
oh,
to talk to you about that.
okay. Should I add some adjective like Dr. Elvira told us that you have every right to refuse your medicine. I might not able to make you convinced. Should I add this or not?
Do not underestimate yourself. Maybe you did everything, but
Okay.
it's a
Yes.
problem with him.
Yes.
Yeah, I didn't take this station in my exam before, but I'm just giving you how to approach it, because actually when you are having a subordinate patient, I find it, me myself, I find it an easy task to convince him, maybe because this is something I'm having that I can convince. But if some other people cannot convince, you can definitely talk to a nice way, in a very nice way, and say, definitely it's up to you, the decision is up to you in the end of the day, but do not give up quickly. Just let it be the
Okay.
last option. For example, definitely it's your right, the decision is up to you in the end of the day.
Okay. Okay.
However, I was just telling you for your sake, because we don't want you to have these complications. At least show
Okay.
I
that you
mean,
have. Yeah.
I think in my case, I just talk too much. But anyway, I'm not sure that Masi will be able to say, unfortunately, I wasn't able to persuade you. But in the end, I think two things have to be said. That I respect, you have every right to refuse a treatment, because every person here in this country is free. I
Yeah.
can't make him take anything. When he is adult, he is mentally has a mental capacity, he can refuse a treatment. And first of all, and secondly, we have to respect. And I think if we verbalize, even if I say to my daughter, I respect what you want to do, I think she will be happy. If we say that I respect your decision, I think there's nothing wrong with that.
No, no,
This
I
is
don't
this
know.
this
this
is
is
the right. No, Dr. Elvera, this is the right, but the sentence that I believe I couldn't. Rather, you say that now I believe that you understood what are the complications and implications.
Yes, yeah.
And you
Yeah.
are adult. You are adult.
Yeah.
So you're acknowledging that you have checked those things. Okay.
Yes, yeah, exactly.
So
Yeah.
you say, you don't say that I'm sorry that I was not able to convince you. No, don't say this kind of.
No,
Rather,
but I've already no. Yasmin, I've checked that already.
guys.
yes.
Before
Let's
I've checked
postpone.
that
Let's
he.
postpone this till the end because we still have 2 minutes stations left. Okay, we are very late today. I will discuss everything with you guys. I swear. This is a good point that you brought, Dr. Elvira, and I need to tell you something. Me myself, I would not go for that. I have to be honest with you. I would not go for that. It's up to you. Or sorry, I would not go to. In the end, I respect your decision. It's your right to refuse. But if I ever go for it, I would tell him that, of course, I'm just trying to convince you. But in the end of the day, the decision is up to you. You know, it's our duty to convince you for your sake. We don't want anything, any complication to happen to you. I said that in the beginning to my patient during a mock and managed to form a good rapport by ensuring that the decision was his. It might help to convince him. Uh, Dr. Safa, I have a problem. If you say mock, this word like itch me. This word like I have problem with this word in the mock because the mock is a plabber, ex-plabber. He's not a GMC examiner. He's not a GMC simulator. Okay, this is what he got. But by the way, this guy may be having different perspectives of station. Like for example, the GMC guy, the GMC simulator, he could be having different perspective. Why he needs you to convince him and keep convincing, and in the end, when he does not respect or he does not accept, actually, okay, you can tell him what Dr. Elvira said exactly. But even when you say it's up to you, the decision is up to you at the end of the day, definitely. And it was my pleasure to talk to you today. But the thing is that I'm not sure actually if you say this in the beginning, Dr. Safa, it will be fine. Why? Because some simulator, if he's really stubborn, he can tell you, okay, if it's up to me, why do you convince me? Okay, I told you I will not take it. Why you arguing with me? I will not take it. He can't say this. Okay. No, you can simply assurance is something else, Dr. Safa. That's I told you in the beginning. Okay, we are going to talk to this. I'm just talking to you today because we need to reach the best possible option or the best possible plan for your health. Guys, enough of discussing this patient, okay? I have a good idea. If some people are confused about some stations, like this station and the Breaking Bad, you can write them down in a paper, okay? Especially ethical, but don't write every station for me, okay? I mean some ethical stations, especially when they are too challenging, write them in a paper and we can practice them. I will be a doctor in them so that you will know how it works sometimes or how I'm going to convince them. Because, you know, it's very easy to say, I'm going to say this and this and that, or I'm going to skip this. No, it's not about what you're going to say. It's about maybe how you are going to deliver your point to the patient. I noticed that some people start convincing someone by telling the complications, number one. I'm afraid that if you do not take this medication, you will end up having a stroke, and after the stroke, you will be restricted to the wheelchair, and after the wheelchair, you will not be able to move around, and I'm afraid that your life will be ruined. Okay? So, and he comes out of the cubicle, and he tells, oh my God, I failed this station. I said everything, and the examiner failed me this station. He's unfair, and the patient is unfair. No, it's not actually about maybe sometimes there could be like some personal shortcomings that need to be or must be avoided. Okay? Let's move to the next station. Next station quickly, another mental capacity, but it's more challenging. Why? Because this guy does not want to take his medications at all. Sometimes he does not want to take the antibiotics. Some other times he does not want to take other things like maybe heart medication. Some other times he does not want to take, he does not want to keep the catheter, the urinary catheter. So this station differs from one scenario to another, and it changes almost every day. What is the problem in this station? I will tell you what is the problem. The problem is that this guy is really stubborn. He's not stubborn in a bad way. This guy wants to die. This is different from the warfarin. The warfarin wants to live, but he does not want to take the medication. But in the other station, he wants really to die. So you will enter the cubicle, he will tell you, it's like this guy is going to be discharged because he was admitted to the hospital a few days back because of chest infection. Number one, reason for admission. Number two, current condition. Number three, past medical history, as we always agreed. In the past medical history, you would ask him, he will tell you that he was having hypertension and high cholesterol and previous MI. Now your mission. And now you're coping with medications, he will tell you, doctor, I don't want to take them anymore. May I know why? Or may I know which medications? Doctor, he will give you the list full of 4 or 5 medications. May I know why you don't want to take them? He will tell you, doctor, I am having pain and they are not improving my pain. So guys, do you think that these medications, the high cholesterol medications and the heart medications and the hypertension are used for the pain? No. Actually, we'll tell him that, may I know why you think they were for your pain? Doctor, I just think so. Actually, they are to control your condition, to prevent further complications. But doctor, I'm feeling tired because of them. May I know since when have you been feeling tired? I mean, any excuse he's giving to you, any excuse. May I know why you think they are the cause of your tiredness? Doctor, I'm just feeling tired. Okay. So always ask the concern, why? May I know why you think so? May I know why you think so? He will tell you, doctor, I'm feeling tired since the past 2 weeks. And since when have you been taking them? He will tell you since 5 years. So definitely it's not because of the medication. Is there any other reason? Doctor, I believe that I cannot live anymore. What can you do for me? May I know why you think so? Doctor, I'm 78 years old. Can I live anymore? You will tell him definitely. Thanks to these medications, many people are having controlled conditions and they can live even more. Doctor, I don't want to live anymore, believe me. May I know why you think so? Doctor, I have lost everyone, my friends and my family, and all of them died and I'm living alone. He would keep speaking for 2 minutes. Now, sympathy and empathy. So from 3 or 4 minutes of this station, you will start sympathy and empathy party till the end. I'm sorry for that. And how are you coping with that? Doctor, I wake up every morning, I solve crosswords, and I watch some TV, and I get bored. I don't even know how to, I don't even have anyone to visit. I don't have any social activity. I don't enjoy anything anymore. This must be quite distressing. And how are you coping with that as well? Doctor, actually, I don't, that's why I don't want to live. And may I know, how is your mood recently? Doctor, my mood has been absolutely fine. Can you score your mood for me? It's like maybe 7 or 8. So this seems to be quite good. Yes, doctor, I'm not having any depression. I'm not having anything. I'm really aware about what I'm going to say. Okay, definitely. I'm going to talk to my senior and we can stop your medications. Why? Okay, this guy, this is mental capacity. You asked him, may I know why? And then you told him the benefits of taking the medication, which is controlling the progression of the disease and giving him longer life. Number 3, you told him about the complications. You know what will happen if you do not take them. He told you, yes, doctor, I know that I'm going to die. I don't want to live anymore. I'm 78 years old and this and that. Mental capacity in disguise. But before starting anything, always ask why. Why? Why? Always ask why. Why? Any concern in PLAB 2, always ask why. Now, he will stay silent. Also, one more thing, doctor. I know that when my heart stops pumping, he will press on my heart. I don't want this to happen to me. So basically, you mean the chest compressions? Yes, doctor. I don't want this to happen. May I know why? Doctor, because I need to die in dignified manner. I don't want to live anymore. Do you know why we do this chest compression? Yes, doctor. I know that these chest compressions are to pump the blood or to help the blood go back to the heart again and to help me breathing. I don't want this to happen to me, doctor. Do you know what will happen if we do not do it? Yes, doctor, I know that my heart will stop working or stop functioning and I'm going to die. So please let me die in peace. I'm so sorry for your experience again. Don't you think that this is a big decision you need to discuss with someone else? Doctor, I will not discuss it with anyone else, doctor. I know that my daughter will always refuse it because she wants me, but doctor, please respect my decision. Okay, I'm going to talk to my senior and we are going to arrange the relevant documentation. What is the relevant documentation? The DNAR form. You are going to sign it. This is the station. Sometimes he does not want to take the medications for the heart. Some other times he does not want to take antibiotics. So if anyone does not want to take something, you will assess the mental capacity, if he is understanding what he is doing or not. How to assess mental capacity? Number one, ask why you don't want. Number two, why? Number three, why? Number four, explain benefits. Number five, explain complications. Number six, respect the decision. But you can also in between, like after explaining the complications, you can ask about the mood and if he has talked to anyone about this or not. In the end, you have to respect his decision, Dr. Yasmin, Dr. Elvira. Why we do have to respect the decision? Because he is fully competent. The guy is fully competent, guys. So if he is fully competent, this means that you have to respect the decision and you have no way out. Okay? Okay. Has anyone got, by the way, this station recently, not recently, since maybe August, it came with a twist. Which twist? The twist here is actually that you have to sign the DNR form. How to sign the DNR form? Okay, I'm going to send it to you right now. How to fill the DNR form right now. Yep, Dr. Tashi. I'm going to send it to you right now on the WhatsApp group. And I'm going to send it to you, to Dr. Nigar as well. I'm sorry for the poor quality because actually I took it from my laptop. This is how to sign the DNR form. Mind, check the WhatsApp group right now. You will find something, you will find some words written by big font, like black dark font, and some other words are written normally, like for example, plain font. The highlighted points or the darker black ones are because of or are the answers to the questions, or are the answers that you should answer or how to write it. Okay. This station simply is about mental capacity as well. He is having multiple sclerosis and he wants to sign the DNR. So this is a DNR form. Check how to sign the DNR form. Okay. Starting from the point number one, does the patient has mental capacity to consent? Yes, he has mental capacity. Summary of clinical findings. You will tell in the summary of clinical findings that the patient is having advanced multiple sclerosis. And he thinks that the CPR is unlikely or is inappropriate because he wants to die in dignified manner. Summary of the communication with patient. Communication with patient, again, you repeat the same thing. The patient wishes DNA CPR because he's having advanced multiple sclerosis and he wants to die in peace. Summary of communication with patient relatives, not discussed with relatives. He did not discuss with relatives. Name of members of multidisciplinary team, it's not discussed with multidisciplinary team as well. Healthcare professionals recording the CPR. Now you write your name and role and date. Your name is, for example, Dr. Masih Manzoor, and your rule is FY2, and the date is your exam date, inshallah. Review and endorsement by most serious professional. Okay, you write in it consultant to sign it, or you can leave it blank or put like a dash in it, just a little bit dash, as if it's going to be discussed or it's going to be endorsed later. This is very simple. So in every point you will write advanced multiple sclerosis and wants to die in peace. advanced multiple sclerosis, and wants to die in peace. You'll always repeat this in all the forms. Okay? This is the form that we have got so far, the filled form. And it's very easy, by the way. It will barely take you 1 minute and a half or 1 minute. This station is very short. This station is like a gift to you in your exam date. Learn how to fill it in less than 1 minute and you'll be absolutely fine. And please, before filling it, excuse yourself from the patient. Like, excuse me, I'm going to sign my documentation right now. If you are losing the eye contact with anyone in PLAB 2, please always excuse yourself. Otherwise, I will kill you. I mean, even if you escape from the GMC, you will not escape from me. Seriously. This is disrespectful to the patient. Okay, guys. Has anyone got any questions? Okay.
Dr. Ahmad, do we need to ask the question that are you giving diffusion only for the DNR or complete like about the other active treatment you are getting just like IV fluid? Should
Okay.
I ask there or no?
Actually, the good point is that he will. Yeah, you can ask this question. I have been asked this question by someone like some other candidate as well, and he asked me this question: should I ask about these things? You know what to do. Here to do simply, you can ask him, do you wish any other help or do you wish any other intervention? Like for example, when someone heart stops, we do this and that. He told you it's up to him. I don't know actually what will be his answer, but what I really know is that he's just refusing the DNR, which is the ultimate help. The ultimate help to anyone when he's dying is the DNR. So if he's refusing them, I bet that automatically he's already refusing the other helps. But maybe he can accept some palliative care sometimes. By the way, I think, I'm not sure about the palliative care because I know that the DNR form is for the DNR only. But the palliative care it's something like humane. You can do it even without the consent.
Separately. You have to ask separately and notify on the record.
You mean the palliative care?
Yeah. Both the things you have to write down separately. Like for palliative, you have to write the wish. For DNR, you have to write on the top page of the folder. So it's not combined. If he is refusing DNR, but he might be giving you the okay for other things.
Okay, so you can ask this question. This is a good point.
Yeah.
But I remember that in the task it says sign the relevant documentation. So they are going to give you this DNR form and you're going to sign it only. And his concern, you can ask this question, like for example, do you want, basically your concern is about only the CPR, not the other measures or not the other interventions. He can tell you yes or no. I don't know. I'm not really sure about that. I don't want to give you like wrong answer.
No.
So this is a good point, Dr. Yasmin, actually, but I'm not sure about it, I have to say.
Someone is asking about the signature. So we, as a FY2, we are not going to sign. Our consultant is going to sign.
Dr. Kashi, you will sign your name and rule. You see in the bottom, name and rule. Yeah. And when it comes to the pattern of the consultant or the senior professional, you will write to be discussed. Or you can leave it blank or write a dash. Like simply put a dash in it. Why? Because it's going to be discussed in a while. Okay. We are very late today, by the way. Okay. Let's move to the next station. Next station is okay, withholding cancer diagnosis. What is a withholding cancer diagnosis? Actually, this station is the first ethical station that everyone had. I think it is the first ethical station that everyone studied. Muhammad Ali, he's the opposite. He does not want his mother to know about her cancer. So this guy is having some record or some concern that his mother is likely, her mother actually, or his mother has been diagnosed with cancer in the abdomen, intestine cancer, and he does not, or brain cancer, and he does not want you to tell her about the condition. What you can do here, okay, this station goes like, hello doctor, I'm Mr. Muhammad Ali, I am the son of Mrs. XX. Doctor, actually I'm having some concern. I know that my mother had been diagnosed with cancer. Now we will tell him, I'm so sorry for your diagnosis. It must be quite tough for you. Yes, it is, doctor. But doctor, I just have some other concern I wanted to share with you. Definitely share with me. Doctor, I do not want you to tell my mother. May I know why? Doctor, she is very sensitive, and if she gets to know, she may die out of the shock or surprise. I'm so sorry for that. I'm sure that you care about her and you know her better than anyone. But the thing is that don't you think it's her right to know? Doctor, I just do anything, but do not inform her, please, doctor. Tell me, and tell me. I mean, you can explain everything to me, but not to her, doctor, please. Well, I can see that you are quite concerned and worried about your mother, but don't you think that if we do not tell her, this can affect our management and support to her? She may lose the trust in us at any time. Because, you know, sometimes this condition can be having some complications, and if we hide it to her, she may get to know later and she will lose the trust in us. Doctor, please don't do it. Please, doctor, she may die if you tell her. Now, okay, so number one, you will tell him that it's her right to know, but in a nice way. Number two, you will explain to him that you are going to break in layers. How? In a sensitive, delicate manner. For example, you are going to ask her, does she have any idea about the diagnosis? And how much does she want to know? Would you like anyone to be by her side? And you will handle the conversation in a sensitive, delicate manner that will not, and will give her the chance to ask, and we will be very careful and alert about her feelings. So now you will tell him that it will be breaking bad news. Now you have to explain to Muhammad Ali the concept of the breaking bad news. Doctor, but can you simply skip the word cancer? Don't say the word cancer. May I know why? Doctor, because the word cancer is a very bad word in our family. Why it's a bad word? Because my father was having cancer and he died actually 6 months ago as well. I am so sorry for your loss again. Please accept my condolences. But don't you think that she was living with your father as well and she knows how the cancer goes? So she will get to know sooner or later about it. So the lady knows about the cancer because she has seen it before with his father. So she knows about it. So she will get to know sooner or later that she's having cancer. Doctor, but okay, tell her any word else, but don't say the word cancer. May I know, do you have anything in your mind we can tell? Yes, doctor, tell her the word growth. This is a very good point. We can tell her this, but the problem is that most of our patients will, when we say growth, they ask us what do we mean by it. And if they ask us this question, we need to explain to them what we mean. So you'll explain to them that they will ask. And when they ask, we have to tell them what do we mean. Doctor, but can't you skip it? You can now tell him what we can do here is that after disclosing the condition to her, we can ask our nurse colleagues or anyone else to write in the documents to not tell her the word cancer anymore. Like, for example, you told her now and you explain. After this, when she knows about cancer and everything, do not tell her that you're having cancer. I mean, after disclosing and after explaining and after telling the diagnosis and everything, now don't use the word cancer because it can hurt her feelings. So we can make a note that the word cancer will not be said to her again. Okay, doctor. Okay, that's better. Doctor, when are you going to explain her condition to her? May I know what's your concern? Doctor, I want to attend it because my mother will not understand English. You will tell him that we will arrange a translator for her. Someone will translate her. Don't worry about that at all. And because we need also to check her understanding. Doctor, but if I feel that the conversation is going so deep and she's going to be affected, can I interrupt you? Actually, I'm afraid that this can't happen, or this is not possible to happen, or this is not possible. You know that your mother deserves to take the full chance to receive the news about her condition and to check her understanding. So he can't interrupt because this will be interrupting to his mother understanding and his mother flow. Okay, doctor. Is there any other concern I can help you with? No, doctor. No, just please make the note that you won't say the word cancer anymore. Okay, thank you. This is a station. This is a very easy station, and all of you know it. But the most important thing is that you have to tell him, number one, it is her right to know. Number 2, it will be breaking bad news. Number 3, we can use the word growth, but most of the patients will ask us what we mean by it. So we have to explain to them. Number 4, however, if the word cancer bothers, we can later on we can change it and make a note that we will not use it anymore. Number 5, you cannot interrupt. You cannot interrupt her. You cannot interrupt her while explaining the condition. Number 6, and you cannot be attending unless the mother accepts. You cannot attend, actually, sorry, you cannot interrupt us because we are explaining to the mother, and we will arrange a translator to translate for her if this is your concern. Okay. This is a station of Muhammad Ali. Does anyone have any question regarding this station? I think it's very easy. Everyone knows about it and everyone has practiced it and read it before many times.
Hello.
Yeah, Dr. Mahdi, yeah.
Is there anything like data gathering here?
This is a good point, Dr. Mahdi. Data gathering applies to any station in PLAB 2. I mean, for example, you can simply ask him how much do you know about her condition, or how was she doing in the past few days, and does she have any other medical condition, and what were her symptoms before. I mean, you can ask him, for example, why did she come to the hospital, and what were her symptoms then, and how were they managed, or how was she coping. Does she have any other medical condition? Does she take any medications apart from that? Any family history of cancer? And lifestyle, you can ask like 2 minutes history, because this station is quite short. I'm just telling you the summary of the station, but the data gathering can be applied. You can imagine, yesterday I told you guys that even the data gathering can be taken in the gender selection. Can you imagine? What the hell can the data gathering do with gender selection? But still, you have to take it, to take marks for data gathering. Just ask some questions, like for example, Hannah, how are you? How are you doing? Do you have any other medical condition? Like this, like a normal chat. But you have to take it in most of the ethical stations. Why? Because you still are marked in data gathering. You have to. Okay? I hope this was clear. I hope this was clear, Dr. Mani.
Yes, this is clear.
Are you sure?
Actually, yes, I was intending to take, I was intending to know how to take data gathering in this station. Because
in this station, why don't you ask me?
Yes, that's why I asked you.
Okay, I have a good idea. It always depends on the patient concern. For example, if the patient is pushing you all the time, if the patient is pushing you all the time towards a concern, can you take data? This will be disrespectful to the patient wishes. Yes. So what you can do right now, you can simply do one thing. You can address the concern, and after addressing the concern, you can move to the data gathering, right?
All right.
This is number one. Number two, you can start by asking him, okay, I'm going to address your concern, but can I ask you a few questions if you don't mind, to be in a better position to know about your mother condition? And after that, you can, it depends. Sometimes he can tell you, no, doctor, tell me now. So this means that he is pushing you toward the diagnosis. If he is pushing you again, you have to tell the diagnosis or the concern, and in the end or meanwhile, you can take data. For example, I will tell you something. There is some station in the counseling in which the lady is discharged with many medications, and you have to explain the medications to her, all the medication lists.
Mm-hmm.
Can you imagine?
Then?
And actually, this station, the lady may not let you take much history. She will push you toward the medications all the time. What you can do here, Dr. Mahdi, you can explain each medication. For example, you are going to explain the co-amoxiclav to her. While explaining the co-amoxiclav, you're going to tell her, and this is for the urinary tract infections that you've been having in the past 2 days. Tell me, do you have still any problem in your urine? What about a smelly urine, any cloudy urine, any burning sensation? Like this. See, now you are incorporating data gathering in your explanation. Isn't this a smart way? Definitely, it's smart and very professional, and very nice way to include the data gathering. So your data gathering can be fit either in the beginning or in the end or in the middle. And I believe that you need to be very good, like very aware and very knowledgeable about your station to incorporate the data gathering in the middle. Otherwise, you will end up losing track.
Okay.
You got it?
Yes, yes, I got it very properly.
So I want you to always like try the data gathering. Okay, okay. This is one of the counseling stations, Dr. Masih. In this station, actually, the data gathering will be the station that she will be discharged with many medications, and you have to explain the medications to all the medications to her. So still, you have to take some marks for data gathering. So what you can do here is that you'll explain the medication and ask the relevant history. For example, you are explaining the cocodamol or the codeine. Now, this codeine has been prescribed for your pain in your leg. How is your leg right now? Do you still have pain? Did it improve right now? Do you take any other medications for the pain? Have you tried any other medications before for the pain? Okay, this medication is going to help your pain, and we are going to prescribe it for you, for example, up to 4 times per day, twice per day. And this medication in the first few days will be taken twice, but later on it can be taken per required need, which means that when you're only having pain. See, I took the data gathering of the relevant condition with the relevant drug. I hope you got my point, because in the beginning of the station, she will not let you take much data. But you still have to ask data to take some marks, because there's a compartment called data gathering. That's why you can incorporate your data. Otherwise, you can ask the data in the end, this history, but I'm not sure if you'll have time or not. That's why I always advise the people to say, I'm going to ask you a few questions in the beginning. If the patient is reluctant, now move to the concern. And while addressing the concern, ask some stations. In the station of the angry consultant son, you will tell him in the beginning, how much do you know? He will tell you, I know everything, I know everything. He will not let you take any data. So after proceeding with him in a while in the station, you can tell him, meanwhile, can I ask you, how was her medical condition apart from that? Did she have any other symptoms? Are you aware about any medication she's taking? Does she have any allergy? Like this, during your discussion. And this is a better way, by the way. You're smart. He cannot turn you down in this way. He can never turn you down. I'm really sure. Okay. Now, let's move to the next station. Another station from today. Wait, let me pick it up. Discharge discussion with the son. You know, this mother has had a fall in the home, and she had fracture in her left. She had a fracture in her left hand. Left hand, and she's right hand. Okay, so she had a fracture, and she's going to be. She has been treated very well here, and she's going to be discharged to the home. What happened, or what has been done in the hospital? You have stabilized her. You have provided her with a cast, and you have provided her with a walking aid as well. So a cast has been applied, and you have been provided her with a walking aid to be able to walk. This is number one. Number two, there has been follow-up every 2 weeks in the fracture clinic to follow her up and her improvement. This is number two. Number three as well, she will be having full plan with the physiotherapist, and actually your colleagues, the physiotherapist and the surgeon and the occupational therapist, have decided that she is able to go home. We will be discussing only 3 or 4 stations of psychiatry. Okay, so everyone is happy for her going home. Number 5, staying in the hospital, furthermore, has been decided to not be appropriate by the MDT or by the doctors. Number 5, many investigations or all the investigations have been done to find out the reason of the fall, and no reason has been detected. Talk to the son, address his concern. So everything here has been done. Fracture has been stabilized. Walking aid has been provided. Investigations have been done. Follow-up has been decided. All your colleagues are happy with her sending home. One more thing. There is a service called Home to Hospital Service Scheme has been decided to her. Okay. And in this, actually, there will be a carer. A carer was here in the first. He will visit her regularly in the first few weeks, like first 2 weeks. So this has been decided. A carer will accompany her or visit her home in the first few weeks, like regularly in the first 2 weeks, to comply with her needs. Talk to the son and address his concern. Now you'll enter the cubicle and you'll find the son, and he is quite worried and angry at the same time. How can you send her home? Doctor, may I know what's your concern? She's had a fall. How can you send the old lady to home? She's having a fall. How can you do that? Now you will start taking some history from him. I can see that you're quite frustrated with that. I just need to ask you a few questions to be in a better position to answer your queries or answer your questions. So please bear with me. Okay, doctor, what do you want to know? Now, ask her some questions. Like what? Ask him some questions. Like what? May I know how is her medical, for example, what happened in the fall exactly? He doesn't know what happened in the fall at all because he was not at home. So take some medical history about her, like medical conditions, any medications, and recent health. Recent health here you can ask about if she had any recent infection, if she had any morning headache or blurry vision, if she had any heart racing recently, the reasons of the fall. He will tell you, doctor, she's absolutely fine. She doesn't have anything, I think. Now ask about the home conditions. Wet floor, carpet, enough light. So medical history. Number two, social history. Sorry, the home history. Medical history and home conditions are very important here. So tell him after that, thank you for bearing with me. Actually, many investigations have been done and all of them came back now. You can explain the investigations as well. You can tell him that these investigations were routine bloods, full blood count, and liver and kidney and ECG, and you can explain everything. They came back normal. ECG came back normal. Eye examination came back normal. Everything came back normal here. So what could be the cause of her fall, doctor? The cause of the fall is usually, at this point, could be the weakness in her bones or her muscles, which usually happens after old age. Oh, doctor, so this means that she's going to have a fall again. Let me tell you what we can do or what we have decided to do. Now we are going to tell him that actually it can happen, it's a possibility, but let me tell you what we have done and what we will do to prevent this from happening. Okay, tell me. Now you will tell him that you have a stabilizer fracture and you have provided her with walking aid. Number two, he will tell you, doctor, but she will not be able to walk. How can you send her home? You will tell him that she has been provided with a walking aid and she has been taught how to use it by the physiotherapist. Doctor, but what else? What have you done else? Now you will tell him that we have decided to follow her up in the first 2 weeks, like after 2 weeks in the fracture clinic to see how her fracture has gone. And also our physiotherapist has seen her and the occupational therapist has seen her as well, and all of them are happy with her discharge. Our colleague, the occupational therapist, as well, have explored her home conditions, and she has been decided to be fit enough for discharge. Not only this, we have arranged a carer for her to look after her needs in the first few days, and we'll visit her regularly in the first 2 weeks at home to check on her. One thing I forgot to tell you that you are asking medical history and after that the home conditions, you can also ask some social history. Like for example, who takes care of her? Any relatives or anyone beside her? Before disclosing the management. So he will tell you, doctor, but what if she has a fall again? And I told you that this could be one of the complications because it happens due to the weakness in the body. But in this case, actually, you can contact your local council. They can provide you with alarm. Sorry, they can provide you with some service, risk assessment service to explore the home and prevent the or to assess the home conditions again, and maybe they can like fix a temporary escalator if you're having 2 floors, or they can fix tight bars. So If he's still very worried, you can arrange two things. Number one, you can arrange alarm in the common places of fall, like the bath. Number two, he can contact the local council to assess or to sort out the risk assessment service. Risk assessment service provided by the local council to provide some measures to prevent against the fall. Doctor, can't you keep her in the care home, or can't you send her? Can't you convince her to go to a care home? May I know why you want so? Doctor, I'm not comfortable with her. No. Before the care home, he wants to keep her in the hospital. If he wants to keep her in the hospital, you would definitely tell him that it has been decided it's not appropriate to keep her in the hospital for many reasons. Number one, staying in the hospital can be disappointing for the old age. Number two, her condition is absolutely fine. She has been decided to be fit enough. Number three, staying in the hospital actually has got some complications, like infection, especially in the old age. Then he comes to the care home. May I know why? Because doctor, I don't want her to stay at home. Okay, the care home is a complicated decision to be made by elder person, and it needs quiet discussion. So tell him that, have you ever talked to her about that before? He will tell you no. Don't you think it's not the right time to talk to her? Because she has already come out of a fall, and after the fall, the old person is actually disappointed and feeling a little bit inconfident. So don't you think postponing it can be a better idea? At a different time? He will say, okay, doctor, that's fine. So this is the point here, is that actually he has to, number one, you have to convince him, number one, that she has been provided with a walking aid. That's why she's able to walk back again. Number two, all the investigations have been done and they came back normal. And the occupational therapist and physiotherapist, all of them have talked to her, and everyone has decided her to be fit enough for discharge. Number three, he is asking about the hospital thing. About the hospital template, you cannot keep in the hospital for the reasons we said. Number four, let me tell you what we have arranged for her. He will speak about the fracture clinic and about the physiotherapist and the occupational therapist and the carer. Number five, he will, if he is really worried, you can speak about the alarm, and you can speak also about the risk assistance service. In the end, he will ask you about the care home. In the care home, you can emphasize that this is a big decision and it needs different time and setting. Okay, okay. Anyone has any questions so far? Okay, give me 1 minute, guys. We are left with 3 ethics stations. We will discuss them quickly. They are the hospital policy, number 1. I know there are 2 ethical stations, hospital policy and gonorrhea. We will discuss them in 10 minutes exactly. And after that, we will move to the psychiatry stations. We will discuss today we'll discuss the many mental state, the delusional disorder, and we will discuss also the two suicidal attempts. Just give me 1 minute exactly. Hello, everyone. I'm sorry for the delay. No news about what, Dr. Zaid? Tell me, no news about what? Hey, answer me.
It's always good news.
No, tell me which news.
No, I just put this one in my mind. No.
Okay. Seems that you sent it to the wrong chat.
No news.
Okay. Dr. Zai, tell me honestly, are you concentrating today?
Yes.
I mean, are you learning in this session? Because you told me that you have problem with the Breaking Bad news and the ethics.
Yeah, I do have problems in that because I failed in almost I failed in 3 out of 4 ethical cases I had. Yes, yeah, I have a problem with that. I admit that, and but I want to practice more because they are not familiar for me. I wasn't exposed to that one in my life. Yeah.
By the way, I don't think that you are not the only one. Actually, everyone here. Even Dr. Zaid, even if you are not exposed, or even if you are exposed, believe me, it's different from the way it works in our countries. I'm sure you know this.
Yes, see, for example, if I face in my clinic a Breaking Bad news, so I will escape, I will try to shift the patient to another. So that's what we are doing here. And even if I face an angry patient, I will skip from them. I will skip from them.
Yeah, actually, what happens, Dr. Zaid, I have to tell you one thing. The good thing, I'm sure, I agree with you. Actually, I agree with you. Though I did not fail any of the ethics session in my 2 attempts. But the thing is that I have to be honest with you. It's not about the script. I mean, see, I have been spending more than 3 hours teaching you some concepts and some notes. But believe me, no matter how I teach you, it's not spoon feeding. Here in this part, particularly in the counseling and the ethics session, it's all about yourself. For example, you can be the most knowledgeable. Dr. Zaid, I'm sure you are pretty good. You are, mashallah, you are good doctor. You saw many cases. No, you saw many cases, and I'm sure you treated many cases. But the thing is that what is the point if you cannot talk? The English people are subjective. You know how it means. They see. They are the people who like your talks. They do not like your knowledge. They are not like the Americans. They are never like the Americans, not the Germans. Americans and Germans are more objective. But the English people, they are focusing more on the sweet talks. How can you talk? How can you convince? How can you manipulate? How can you this? I'm not saying something bad about them. It's just their culture. Like it's our Arabs. Arabs also are having the same culture. I'm sure you agree with me. And I bet even people, even in Pakistan and in India and most of our countries, this is the culture that I'm going to see how you are going to talk, not what you are going to talk. So this is a problem, and that's why many people, the most knowledgeable people, they do not pass the ethics station. Why? Because they focus more on how to address the patient in terms of knowledge, and they overlook the patient sympathy, the patient feelings, the patient whatever. So this is what I needed from you to do, is that if you are, believe me, Dr. Zaid, if you are calm enough, I'm pretty sure that you are going to pass it with flying colors. Seriously.
I hope that.
No, definitely. I just need you to work on 2 things that I'm going to tell you in public. I'm going to tell you that you need to work on your flow, not flow like English. You don't have problem with English. You just have problem of stress. How to stress? Don't worry. It's my mission. See, Dr. Elvira, she stressed you. You can double right now the stress that I'm going to give you when I'm not comparing myself to Dr. Elvira in terms of acting. No way. I'm sure she's better. But I'm telling you that I'm going to give you more stress. Okay? If you are subjected to this stress, believe me, you are likely to tackle any hard scenario in PLAB 2.
Yeah, that's true.
I told you, I swear, when I sat in front of the patient, I told her, I was like, come on, you cannot simulate like me. You cannot simulate like my simulators. You cannot simulate like Dr. Elmira. You cannot. So why should I be worried of you? That's what I'm saying. You are going to the exam with second intention. Yoga class. Thank you, Dr. Masih. Definitely, Dr. Masih is giving us and offering us the best options. I'm a fan of Dr. Masih.
See, yes, I need to be relaxed. Yes, you're right. You're right.
Yeah,
Yes.
by the way, even inshallah, when you practice in this country, you have to focus on this thing, because these people are quite subjective. They are looking at the way you talk. They mind this too much. They mind the facial expression, the body language.
Yeah, yeah.
Okay.
Yeah, you're true. You're true. You're true. Definitely true.
We will definitely we will work on that. No need to worry about that. I just need you to do one thing, guys. I need you to always focus on your facial expressions on the mirror. They mind too much. They mind too much, more than you can imagine. Your facial expressions and your body language. Dr. Zaid, I noticed that you make two epic mistakes. You are always bending forward, and you are interlocking your fingers in a way that shows that you are stressed.
Yeah, interlocking fingers. Yes, right. Yeah, I'm trying to calm myself. Yes.
No, this shows actually that you are anxious. This is not you are calming yourself.
Yeah.
Really? Dr. Masih, you asked the best question. You asked them the best. You are like going to whom? You are going to the enemy and ask them, for example, what you wanted from me. You know, the GMC, they actually will tell you to stay calm, and that's true, because you know that all of us are doctors, but all of us are stressed because we are scripted. That's what they know. Definitely, you mean that the ID checker. This is something else. You ask the wrong person. You ask the wrong person, Dr. Masih.
Yeah, stay calm.
Yeah,
that's true. That's true. Actually, I was very, look, I dealt with the exam just like the OSM or the CS. The American, they marked, they put more attention about the confidence. How confident are you? And the other ways, how to push, how to open the door, how to act in front of the patient. But here, I wasn't in a relaxed environment. In my exam, I wasn't very stressful. I wasn't really calm. I wasn't calm. That's from one. Number two, and it was something weird.
It happens because of two things. Because actually, by the way, this is different from the CS. You agree with me, right?
Yeah, definitely, yes. CS is much easier. Yeah.
Which is much easier?
The CS.
Yes, definitely. The CS is very, and it's a bit objective rather than this one. I mean, you have a checklist to be marked upon in the CS, but here, no checklist.
Yeah, true.
Okay, Dr. Masih, you always say that you're going to sleep, and I find you awake after 1 hour, and only Allah knows what you are doing. Okay. Okay. We will finish in 20 minutes, guys. I will promise I will make these two stations with delusional order, and I will finish this day, because actually psychiatry is my favorite. I cannot give up on psychiatry today. Okay, so let's discuss the hospital policy, the most boring ethical station for me, I have to admit. The most boring, and with one of the most boring simulators, and Dr. Yasmin scored high in it, mashallah. I prefer, I'm democratic. So I will say that Dr. Yasmin will explain it to me right now. Why I did not have this station in my exam, I did not have it, but she had it, and she scored, mashallah, she scored very high in it. Dr. Yasmin, explain it right now. This is your task right now.
Okay. Yeah.
Do you know the task itself first?
Yes.
By the way, your voice.
Okay. Some young, not very old, young grandson, 25, 28 years old, suppose Albert wants to talk to you, and like in the bracket it was written that grandmom is in terminal condition in the hospital. Talk to him. That's it.
Grandmother.
Grandmother, yeah. Grandmom, grandmother. Okay. So she is admitted and she is in a terminal condition. He wants to talk to you.
Yeah.
So then I went inside, greet the examiner, greet the grandson, Albert, pretty normal. Then after that, I introduced myself and I said, how can I help you? Then he said, doctor, I have some thing to discuss. Okay, then I started by acknowledging that, okay, you are the grandson of Mrs. This. Like I just checked the relationship with this son with the patient. Okay, and he said yes. Okay, then I encouraged. First of all, I encouraged that I must say that you are a very, like concerned grandson, and your grandmother is very lucky to have you. He became very happy with that. And after that, I said, okay, what's bothering you? Then he said that, like here, my grandmother condition is very severe, very like critical. So our relatives are coming and visiting. So I don't know what's going on. Nurses asked me to talk to you. Then first I asked about how your grandmother, I know she isn't critical, but even then, could you tell me what's going on? Then he said that everything has been declared by the MDT that like, yeah, I don't know when my grandmother will be gone, like this. I'm sorry to hear about that. Very sorry to hear about that. But now tell me what actually is the point of concern. So then he said that, you know what, like in our culture, relatives comes and you can't limit them, you can't stop them. But nurses are like giving us tough time and saying that I need to talk to you regarding, like only 2 visitors can come. Then I checked the level of knowledge about this policy. He said, yeah, I know about that, like 2 to 5 o'clock or 2 to 4 o'clock are visitors hours, and after that, this and that. Then I encouraged that, okay, I'm very happy that you are already updated with the hospital policy. But do you realize that what is the reason for nurses are talking this or like making issue about this? Then he said, yeah, sometimes they are saying that other patients they are getting disturbed, but I'm trying that my visitors will not make any noise, like. So then I said, yeah, that's a good thing. Yeah, but even then, like there are some other patients. Your grandmother is in the general ward, so the next patient might be having more complication and might be suffering with this. Then he said, yeah, but what to do? Like my relatives are not ready to accept this. Okay. Then I said, okay, do you have any idea that you can, for the praying purpose, there are praying area in the hospital where you go and pray for her. Then he said, no, but it is our ritual that we want to pray on next to, close to the patient. This is our ritual. I said, okay, we do respect all the religion and rituals. But again, as I said, there are generally private rooms are available, but I need to check with the head nurse that if there are any private room available, then definitely I will come back to you. And then he immediately said, oh, you are so kind, doctor. Okay, then after that, what else? Then he said, yeah, actually, like very soon, one of our priests is coming to make a combined, a big, prayer session. So will it be again affecting others and like this, distracting for others, this, that? And I said, it can be, but let me talk with the head nurse. If you are getting some private room, then it would be much safer for you and for others also. It should be okay. He said, okay, I will be more than happy for that. Finally, he came to the last concern, keeping the Bible, head side, Bible on the head side. Then I said, why you want to keep on the head side? Is there any specific reason for? He said, again, it's our ritual. We want to keep that. Then I said, do you have any idea that every hospital, every unit have their own Bibles in the shelf, kept in the shelves? There are some hide area over there, you can find it. He said, no, we want to keep our Bibles on our grandmother's head side. Then again, same response I gave that, okay, it is again, I need to talk with the nurses, the head staff, head nurse. As long as it is not going to make any hindrance in performance of the nurses or any medical team, I believe it is not a matter of concern. It would not be a matter of concern for anyone. So let me talk with them. And then he said, you are very kind and no one before you talk like this or told anything like this. That's it. Even then, I believe I had 1 to 2 minutes left.
So you addressed all. Didn't you speak about the hospital chapel and these things?
Sorry?
The hospital chaplaincy team. The chaplaincy team.
No, I didn't say that.
Okay. The Bible. Remind me again what you said about the Bible, because this is intriguing. This is different point between the academies. Tell me.
Yeah, I know. So I said, why actually, I asked why you want to keep it on the head side. Then he said, it is our ritual to keep the Bible just as close as much to the patient. So then I said, okay, do you have any idea that every room or, like praying area have their shelves? So that shelves, already Bibles are kept there. Then he said, no, but we want to keep just along with the bedside of my grandmother. For that, I said that, okay, you can do it, but I need to talk with the staff nurse as long as it is not going to make any hindrance or problem in the performance of the nurses or duties. Lots of tubes and everything is attached with your grandmother at this moment. So I need to ask about this, and then I will get back to you. He said, you are very kind. You are very nice. That's the thing.
Perfect.
Like diplomatic way I gave the answer. I didn't say yes, I didn't say no. But I say yes with checking with the head nurse.
With the head nurse?
Head nurse.
Okay. By the way, guys, the Bible thing, it is a point of discrepancy, point of this argument or disagreement between the academies. Some academies believe that you cannot arrange a Bible because it can contain bugs, with all due respect to any book. And some other academies can say that you can keep it, but not by the bedside, just a little bit far away. So Dr. Yasmin's answer was quite wise. There is a Bible in each and every room, but they still need to, they still insist on keeping it beside the patient's head, because this is part of the rituals. Your point was very valid, Dr. Yasmin, actually, and as long as you scored high, this means that what you said was right thing.
Yeah, just like Dr. Mehdi is asking about any academy, I have attended the Aspire, in which mock exam I got this station and they failed me poorly in this station. So surprisingly, in final exam, it came back opposite, because they didn't tell me these points. They just failed me why I was smiling at the greeting point. That was objection in the mock exam of Aspire Academy on me for the same station. Why you entered smiling while from outside you know that grandmother is in critical condition, you have to talk with the grandson. Why you came inside with smiling and greeting? They might be feeling offended on your smile. It was surprising.
No. But the good thing, Dr. Yasmin, is that you insisted on the similar approach, though they failed you. So they failed you, and you insisted on a similar approach, and you passed it to the exam. I like your perseverance. I really like it. Seriously.
Yeah, that's why I'm just making a correction that even though I'm from Aspire Academy, but the way I presented on the mock, they failed me, and I presented in the exam, they just passed me with high score. So now I can't say anything more.
Okay.
I don't want to say actually.
Yeah, this is awesome, seriously. As Dr. Mahdi is saying, this is awesome. And by the way, guys, again, for those who are confused, this shows you that ethics is never about the script.
No. I have written something here, BDI. BDI is Behavior Descriptive Interviews. All these scenarios are BDI, and in future we all be getting this approach throughout these all Europe and North American countries. They check our behavioral approach because we international medical graduates are lacking for this area. That's why even in interviews, one especially psychologists are seated in the interview panel, and they make sketches of our eye movement,
body reactions, yes.
Our body reactions. Just like you have notified, just like
by the way, Dr. Yasmin, I'm sorry to interrupt you, but one of my friends is ophthalmologist, training ophthalmologist in training job. since 5 years. Actually, he's a registrar right now. And he told me that in the interviews he's sitting beside a black a black glass to observe the candidates, and his mission actually was sometimes to observe in the interviews. Actually, his mission sometimes is to observe actually what you say exactly, the body movement, the facial reactions, and the body tone or the voice tone, and these things, because this matter to them in the live interviews, not in the online. But the live
Yes.
interviews, they will be assessed upon it.
Yeah, this is my personal experience. Sometime else I will share about how I learned these things. Sometime else, some another time I will share those experiences.
Yeah, that's perfect. This is perfect. Thank you so much, Dr. Yasmin, really. Thank you really for this elaboration, this brief elaboration, and very nice elaboration for the hospital policy station. But one thing only, I just believe that the GMC examiners, they don't follow this. We know this very well. They just, it is like very personal, like very subjective. Like, for example, if he likes the way you talk, he will pass you. If he does not like you, he will not pass you. It's all about his mood. It's all about, how you're approaching, how you are convincing the examiner and the patient at the same time or not. This is the problem. For example, I can be very good, but I'm not very expressive. This means that I'm not likely to pass, or I will barely pass. Okay, next station is the gonorrhea. And the gonorrhea station, actually the guy has come here a few days ago because he was having some discharge from the front passage. So again, this guy having discharge from the front passage. He has done some screening, and the screening, the STI screening showed that he's having an Neisseria gonorrhea. Okay. So now, what are you going to do now? You are going to talk to him and disclose the test results for him and address his concern. Special note, none. Now you will move to the patient. Talk to him in details, like for example, reason for visit. He came 2 weeks ago because of discharge. What was done? Doctor, I was prescribed, I came here and I did this test and I'm here for the results. Anything else? Like any redness, any swelling, any change in the discharge? No. Ask some history, like past medical history, very briefly. Now the core of this station is the sexual history, because this is STI. Are you sexually active? Yes, I am married and happily married since 5 years. That's great. Do you practice safe sex? Yes, doctor. By any chance, any unprotected sex? Yeah, yes, doctor. That was like maybe 1 week ago. I'm sorry to ask you, but by any chance, any other partner? At this point, he may not open up to you again, like the HIV guy. What you will do, you will tell him, please feel free to share with me. Reassure him. We are not here to judge you. He will open up to you. He had unprotected sex again in Germany, as if Germany is a place where the people were having unprotected sex. So he had unprotected sex in Germany like maybe 3 weeks ago or 4 weeks ago. Any other episodes or any other times? No. Now you can disclose the test results to him, and you're going to say that we have done some tests for you. The STI test or one test has shown that you're having a sexually transmitted infection we call gonorrhea. What is this, doctor? It is sexually transmitted infection which happens or which transmit between the people due to unprotected sex. From one infected person to another through unprotected sex. Why did I have it? Unprotected sex, and it is caused by a bacteria we call Neisseria gonorrhea, which was detected in your culture or your sample. Okay, so now you explain the gonorrhea infection and you explain the causative organism for it. This is number 2. Number 3, you will tell him, okay, doctor, so what will you treat me? We are going to prescribe you antibiotics for that. However, without the antibiotics, or antibiotics are not the only right line of treatment. So, doctor, what else could be done? I'm afraid that you need to inform your wife to come for testing and screening as well. No, doctor, I can never do this. So again, this guy is reluctant to bringing the wife. Now you will explain to him, but he is very reluctant here. The HIV was not very reluctant because he knows that it's a serious condition. But here he is very reluctant. So you need to explain to him that this disease needs to be, or she needs to be tested and treated, otherwise the infection will go back to you again. Doctor, but I don't want this to happen. Now you explain to him that we need to test her and screen her, as I told you. He will tell you, doctor, but she did not have any symptoms. You can tell him at this point that this infection can stay in our body without causing any signs for a long time. However, we need to test her and screen her, and even if the testing came back negative, we need to give her antibiotics. Why I need to give her antibiotics? Because she had unprotected sex with him. This means that the infection likely has transmitted to her. So we need to give her antibiotics even if she does not show any symptoms, because she had unprotected sex with you after your infection. Doctor, but I don't want this to happen. I don't want to bring her. Now you will tell him that there can be some complications. Like what? If she is not tested or screened, the infection will go back to him. Number two, the infection can cause a condition to her called PID, which can cause some other complications to her, like ectopic pregnancy, frequent abortions. And it can have some complications on him if the infection is recurrent or not treated. Like what, doctor? Like, for example, it can affect your prostate gland, it can affect your urethra, causing urethritis, the urinary opening, causing urethritis. Doctor, but are you going to inform her against my will? Definitely. We can never inform her against your will. We always encourage our patients to inform their wives or to ask their wives to come for health checkup. But we can help you with that. We can notify her anonymously. Doctor, I don't want this. I'm afraid that we may need to contact the partners of the infected people within the allotted time, even if you do not accept us. Which means that you are going to contact her later. Like maybe within few weeks, you are going to contact her, or a few days, you are going to contact her, even if he does not accept her. But you are going to contact her anonymously. So encourage to inform wife, number one. Number two, anonymous notification. Number three, if he still does not accept, you are going to notify him anonymously, even if he does not accept, within short time. Okay. Few advices here to give. Number one, very important to be regular on your antibiotics. Number two, have protected sex in the next few days. Abstain from sexual activity for the next few days for at least 1 week. And even after the first week, you will come back to us to review your treatment and review your condition. If everything goes fine, actually, we can stop your antibiotic. And it's very important that you practice safe sex. Again, disclose, explain, inform that he needs to bring the wife. If he's still reluctant, explain why we need to test and screen her. Explain why it could be asymptomatic sometimes. Number three, explain the complications if she is not infected, if she is not treated. Number six, very important, partner notification program, anonymous. Partner notification. Number six, you will notify here anonymously even if he does not accept that, but within short time. The last thing is to give him some few advices. Take the antibiotics regularly, abstain from sexual activity within 1 week, come back to us after 1 week from now, we will review you, and after this, it's always advisable to have safe sex. Gonorrhea will not be as symptomatic in women. Okay, it can be not as symptomatic, but the problem, yes. By the way, the task here says that the HIV test has been offered and it was negative to him in the task. So the STI screening has been inconclusive except for the Neisseria gonorrhea. Okay, so this is the station so far. By the way, this guy is very stubborn. He does not accept anything. And by the way, sometimes he cannot open up to you about the other partner. So what will you do? You reassure him and tell him that we are not judging you. We are used to these questions as medical professionals. And regarding informing the wife, ultimately, after trying everything with him, we are going to tell him that we are going to notify her anonymously within a short time, even if you do not give us the consent. There is only one difference between the HIV and the gonorrhea anonymous notification. Gonorrhea can be, you can do the anonymous notification within some time from now. But the HIV, she must be brought to testing and screening. She must be, like, within very short time, because this is a fatal problem. This is dangerous. But the Neisseria gonorrhea or the gonorrhea, you can inform her within some time. Okay, now we are done with the ethics station so far. I'm going to discuss two psychiatry stations with you, not four. We are going to discuss two psychiatry stations with you so far. Okay. I'm going to start with my favorite station, the mini mental state examination. I know all of you are like it, but I have a very good approach to it. In the mini mental state examination, there are two scenarios in the mini mental state. You can start the station by the mini mental state examination. Okay, the scenario tells you that he has been brought here. He was wandering in the park. He was wandering in the park, and actually, what's next? The police brought him here, and he is confused. Assess the mental capacity or do cognitive function assessment to him. Assess his cognitive function means assess the mental capacity. But again, guys, please mark the word cognitive function.
So what is the difference between this case and the other case of geriatric case?
Which one, geriatric?
This one, is this mini mental state examination or?
Yeah, this is mini mental state.
Yeah, but this is it says if the task say that assess the cognitive function.
Yeah.
It means that we need to ask those 10 questions, right?
Ask what?
Those 10 questionnaires for the...
Yeah. The mini mental state, yes. Okay, I will tell you only one difference. There is one difference is that one patient can be brought from the street and another patient is already admitted in the hospital and he is ready to be discharged. But you have to assess his cognitive function. But in both cases, the task tells you that you have to assess cognitive function or do cognitive assessment to him. Many people do not understand what is the meaning of cognitive assessment, and that's why they go and ask some psychiatric history. And you see him confused without asking him any psychiatric history. But
so
it's very...
Huh? This patient is geriatric patient, is elderly, above 65?
Yeah. Most of the patients, above, at least above 50.
Right, thank you.
Okay. Here, actually, in the mini mental state examination, I like, by the way, guys, Dr. Elvira. Dr. Elvira, how are you?
Thank you, I'm very well.
Dr. Elvira, I know you are having problem with the psychiatry.
Well, no, really. It is quite interesting department, actually.
Yeah.
And unfortunately, it was not taught properly. Where I was studying, and they wasn't given a proper structural way. Everything was made sort of like a joke.
Everything what? Everything what? Excuse me?
Everything was delivered like some sort of joke.
Like what?
I don't know.
Like what?
I don't know. I just was confused. I was whole day sitting down and watching the guy. He was enjoying himself.
Who? You mean the teacher? The teacher?
Yes, and
yes.
I needed a structural approach. I mean, this station can be challenging, as I believe. I myself, I have a bit of a fear of mental people. It comes from my childhood. I don't know, and I don't really know how to approach it properly. So, last time I think I listened to one of your Skype sessions, and there I jotted down the structure, how I will go. So I have it somewhere written. Therefore, I just wanted to listen again to psychiatric stations.
Okay, let's point out it to you, but in a very wise manner right now. I will discuss the many mental state. Yeah, I will discuss the many mental state in 5 minutes. After that, I will review the psychiatry history and I will give you the delusion case only. So today, many mental state and delusions only.
Okay,
Quickly.
Thank you very much. Yeah.
Okay, number one, in the many mental state examination, he is confused. He will going to ask you, doctor, where am I? Now you have no options except to reassure him. How to reassure him all the time? You have to keep telling him you are in the hospital. We are going to take care of you here. Why I'm in the hospital? The police found you wandering in the park. They were just they were just a bit worried about you. Okay, and who are you? I am Dr. XX, one of the junior doctors here. Okay, what are you going to do right now? I'm going to ask you a few questions about your memory. Doctor, what's wrong with my memory, doctor? As a part of my checkup, I need to check it for you, check your memory. Don't worry, we are used to this. And that's why I'm going to ask you a few questions. Some of them may sound strange, so please bear with me. Okay, thank you, doctor. Thank you. Now you will ask him, number one. So now you see how I built a rapport with him. I reassured him, you are in good place, you're in safe hands, you're in good hands. We are just taking care of you. We are going to assess your memory. Okay. So what are the questions to be asked right now? The questions to be asked are very important here. Number one, we assess or we divide the many mental state examination into some compartments. Number one, place orientation. Time orientation. Number one, the time orientation, we ask, number one, you see how I'm going to divide it in chronological manner. What do you mean by chronological manner, guys? Chronological manner means, number one, which year are we in? The year divides into many seasons. So, which season are we in? And the season divides into many months. So, which month are we in? And the month divides into many days. Sorry. So, which day are we in? And when I gather the day and the month and the year, I form a date. So, which date are we in? So, year, season, month, day, date. Each one deserves one. Every wrong answer, every true answer deserves one. Number one. Number two, place orientation. Which country are we in? You know the country divides into county. So which county are we in? County divides into many cities. Which city are we in? Each city divides into many streets. Which street are we in? Each street has got a block of buildings sticking to each other. So which building are we in? So country, county, city, street, building. Okay, now, can you spell word backwards? Sorry, before word, we are going to tell him, can you repeat these three words after me? Apple, table, penny. He will tell you apple, table, penny. That's great. Can you keep them in your mind? Because I'm going to ask you to recall them after a while. Or you can simply tell him from the beginning, can you repeat the three words? I'm going to give you three words. I'm going to ask you to repeat them after me, and please keep them in your mind because I'm going to ask you to recall them later to me. So he needs to repeat them right now, and he is going to keep them in his mind to recall them later. What are the three words? Apple, table, penny. Okay. Now, can you spell world backward to me? World. Don't say, can you spell the word world? No. Can you spell world backward to me? For each letter, right, or each right letter, he deserves 1. So if he say D, L, R, O, W, he deserves 5. Okay? Okay. Now, can you recall the 3 words that I told you? He will say apple, table, penny. Okay. So for the apple, table, penny, 3, each one deserves 1. And if he recalls them as well, each one deserves 1. So if he recalls the 3, he will take 3. Okay? Okay. Now, move to the next step, which is language. You could pick up 2 items. Like, for example, pick the pen and tell him, do you know what is this? And pick a paper. Tell him, do you know what is this? So this is language. Now ask him to repeat a sentence. Which sentence? No ifs, ands, or buts. No ifs, ands, or buts. Okay? If the patient cannot answer any question and he shows that he is stressed, you will tell him, don't worry, I'm going to give you a couple of more questions. Don't worry, that's fine. If he asks you about any answer he's making, for example, if you ask him about the month and he tells you we are in September, is it right, doctor? You'll tell him, actually, we are in April. However, don't worry, I'm going to give you some more questions. Okay, we stopped at the repetition, right? After the repetition, you are going to ask him for some commands. Which command? Can you take paper from the table, fold it into 2 halves, and give it back to me? Take a paper, fold it into 2 halves, and give it back to me. For each order, he deserves 1. For example, if he take a paper, fold it into 2 halves is 1. Take a paper is 1, fold it into 2 halves is 1, and give it back to me is 1. This is complex command. After that, I'm going to ask him to write a meaningful sentence. Like sentence, for example, he writes, my name is X. But if he says my name are X, this means that he deserves 0 in it. The meaningful sentence deserves 1. Okay. After that, I'm going to write a command to you. I'm going to write an instruction to you on a paper. Please try to read it and follow it. For example, I'm going to write to him, raise your right hand, raise your right hand, and I'm going to give it to him. He will read it and follow the instruction. If he does, he deserves 1. After that, I'm going to ask him to do complex drawing. Complex drawing, 2 intersecting pentagons. 2 intersecting pentagons. I bet all of you know about them from the notes. 2 intersecting pentagons. They must be intersecting and they must be pentagons. Usually this guy is having cognitive impairment. Okay, okay. The examiner will ask you, what's your next step, doctor? Actually, you know, guys, sometimes the patient will not let you finish the assessment. If he does not let you, for example, he will keep interrupting you. He will go like, for example, doctor, the wall is very nice. Doctor, I missed my daughter. He will keep interrupting you all the time. So don't be stressed. Do not rush him. Do not rush him and ask him to answer your questions when he is not interested. Always follow him. Like, for example, the wall is very nice, doctor. Yeah, that's nice. You like it? Yes, doctor. Okay, that's great. Doctor, can I have a look at it? Okay, definitely you can have a look at it. Let's finish our talk or our chat right now, and you definitely, after the chat, we're going to look at it together. Or you can look at it wherever you wish after we finish our chat. Was that be all right? So try to make him, or try to act like you are talking to, I am really sorry to say, as you are talking to a child. This is the way of talking. The examiner at this point will ask you, what's your next step, doctor? You will tell him, or what's your conclusion, doctor? You will tell him that the patient is having cognitive impairment. From my assessment, what's your next step, doctor? I'm going to continue my cognitive assessment if you did not continue it. And I'm going to take detailed history, detailed medical history from the patient. I'm going to examine the patient, and I'm going to do some further investigations. Which investigations? Here you are FY2 and in A&E. So you are going to do initials, blood and urine, bloods and urine. And I'm going to also contact the patient family to gain to take collateral history from him, about him. If he is not having family, I'm going to contact the GP, his GP. If he is not registered to GP, I'm going to contact social services. So family, if no family, GP, if no GP, then social services. This is a sequence in anything in PLAB 2. Then I'm going to refer him to specialists. Which specialist doctor? I'm going to refer him to a neurologist to take detailed medical examination from him, detailed medical history from him, do detailed medical examination to him, and do detailed neurological assessment and investigations to him. Which investigations? Like CT scan and MRI and PET scan to exclude any organic problem. If everything comes fine, we will refer him to psychiatrist, or we will refer him to psychiatrist. Why? To take detailed psychiatric history from him and do full cognitive assessment. So again, you will do the initials, and after the initials, contact the family, and after that you will refer to neurologist. Neurologist will exclude neurological conditions by doing detailed history, detailed examination, and detailed investigations, including CT scan and PET scan and MRI. If everything comes fine and no organic injury or no organic problem, now you can refer him to a psychiatrist. Psychiatrist will take full cognitive history or full psychiatric assessment from him. Okay? Okay. So this is the station so far, the mini mental state. Okay, so tomorrow I will resume the next psychiatry stations. We were supposed to discuss them. We will discuss them in the first hour only tomorrow, because we will start the counseling stations tomorrow as well. For the counseling stations, I'm going to send you right now a recording about on the WhatsApp group about how to address any counseling station and how to follow any counseling station approach. Please listen to the recording. It is 8 minutes, I think, or 9 minutes. Listen to it and know how to approach, because this approach is for any counseling station. If you follow it, you'll definitely tackle any counseling station, because this is what I used to do. And this is why the counseling stations were the easiest station for me, together with Essex. Okay, okay. I have to take some rest because I'm having some mini session after a while, and I have a good idea. Who is waking up till late night today? Who is waking up, or okay, or who is ready to take like some like how can I say, like half an hour with me tomorrow morning, because I need to practice 2 stations. I need to me myself. I need to practice 2 stations. The Breaking Bad news. This is 1 station, and the warfarin, the red poison guy. Those 2 stations, I will practice them with any of you. I will be the doctor. Wait,
Me, please.
Who is speaking?
It's Elvira.
Oh yeah, sorry. I'm okay, Elvira. Okay, I will practice the Breaking Bad news and the warfarin thing. What happens is that I'm going to practice them tomorrow.
I have a problem with the warfarin, though. I'm all right with the warfarin. I'll persuade him to take it.
Okay, no problem. I'm saying something else. I'm saying that I will be the doctor.
News.
I will be the doctor because I want it to be recorded so that I post it to the other people on the group.
Okay, yeah, okay. We can do that. We can, definitely.
Yeah, I want it to be recorded. That's why the people who are always like confused about these stations, they will go back to this recording, the 10 minutes recording, to check my performance, and maybe they will be able to follow it and learn from it. So,
all right.
I will practice the Breaking Bad news with Dr. Elvira, and the warfarin, I will practice it with someone else. So please, who is interested to be my patient in the warfarin? Oh, everyone now disappeared. Who is ready to be my patient in warfarin? Why Muniba? You're referring to Muniba? Okay, Dr. Muniba will be my patient. Muniba, give me a tough time. I think I don't need to recommend this to you. No, okay. Then actually Muniba is out of this. Muniba can be a good patient, but she cannot be angry. I know that she can't be angry. I know this is the problem. I need someone who can be really angry, who can be really angry to me. Who can be angry with me? Guys, please cooperate. I know that you're sleepy. Dr. Yasmin can't be angry. Dr. Elvira, okay, Dr. Elvira, prepare the warfarin and come back to me.
You mean I can be angry? Is it a compliment?
You actually, you are a good actress. You are a good actress, Dr. Elvira.
Oh,
It means that you can be angry.
It's a compliment for you, okay? Because you're a very, very good actress. Like
Yeah.
I was like literally laughing when you were doing.
You are laughing, Dr. Maria? You are laughing? Dr.
Yeah.
Maria, you are laughing? Oh, my pleasure. I'm really glad that you are laughing.
Was it look like that I lost my husband?
What?
Yeah, definitely. It was like, it was really, I was so shocked after like looking after you.
Dr. Maria,
I just
don't laugh,
imagined.
because this will be the
Didn't know.
situation.
Should I
Yeah,
celebrate
I
or
thought
cry?
I was feeling pity because he couldn't stop laughing neither, because he actually knows that she's acting. That's why like he couldn't stop laughing yet.
No, I was not laughing, by the way, guys. I wasn't laughing. This means that I'm a boring person? No, because I'm used to this situation. When you enter, Dr. Maria, I have a good surprise to you. Keep laughing until you enter the cubicle and you'll change your mind.
Oh,
Yeah,
okay.
she probably was laughing because I probably performed well.
Yeah, because I
yeah.
know that she is acting
Yeah, I
well.
was just
That's why I
acting
was
well.
laughing.
But I really,
Yeah.
to be honest, I really want us all pass, because when we were on the course, I got an impression that our teachers, I don't know, they didn't instill in us the seriousness of this exam. I mean, we all went. I am talking. No, I don't want to say we all. Me personally, I came out of this the course with the impression that it is just easy. It is just easy, and we can go on do it. It is not an easy exam, and yeah, to be honest, it is not.
It is not easy. Why? Because if you have some personal problems, like maybe I'm not speaking about someone. Okay, Dr. Masih, you can go right now. We are done today. Dr. Elvira, you made a good point. It's not about the exam itself. It's also a personal assessment to you. Okay, Dr. Kashi, maybe because you did not hear me. Just Dr. Elvira and Dr. Maria were talking. But the thing is that I need to tell you one thing, Dr. Elvira. Some personal problems, like for example, if you are stressed or overstressed, or if you are very talkative, these are two problems when it comes to this exam. Otherwise, you are absolutely fine.
No, in my case, I was just stressed. I don't know. It's just something happened with it. I don't know. I was like under the spell. I don't have a problem, and surprisingly, I wasn't talking much. And I was just stressed, and I think it was all shown all over me. As you say, the people can read our emotions. They can read our reactions. Can read our body language. I just wanted to be out of that cubicle. That was the problem.
So you just needed to let go.
Yes. Yeah.
This is the problem, Doctor. Okay, no problem.
Yeah, that's happened to me as well. Yes, the problem that it's not an easy environment. It's like this one is watching us, and there is someone who's the examiner. He's just like a hook on us on his brain. Yeah.
Okay,
So,
okay,
yeah.
okay. So guys, this is, I'm sorry to say, but this can be only done with stressful practice. Dr. Elvira, did you used to practice under chilling conditions, like very peaceful conditions?
What do you mean? I had actually lovely practice partner. She
Lovely,
wasn't
which
that
is not true, which is not good.
No, it's not. No, not good.
Why
Yes.
not?
This is never good, Dr. Elvira. You need
Yeah.
to, you know what? If you want a real practice, you need to practice with someone you really hate.
Oh,
Seriously, that's why you're going to practice with me.
oh, I like you.
Thank you.
Okay,
So
then.
the thing is that if everyone is put under stress, guys, you will go to the exam very ready to any situation, even if the situation changes, even if the scenario changes. Okay, so for today we are done. Okay. By the way, there will be a mini session in few minutes. It will be very short. It will be a ischemic stroke after SOL removal. Someone will practice it in the session. It will take barely 15 minutes. If anyone is interested, join us. If not, no problem. Okay, it will be recorded,
Okay,
guys,
yeah.
but the recording will be posted only here in the group, in our group. I will not post the recording anywhere else.
Okay.
Okay.
Dr. Ahmed,
Yeah.
thank you very much for the session. Would you please write down those little notes you promised to us?
The ethics. I told you.
Yes.
I told you the
Yeah,
ethics
yeah.
stations. This is my mission.
Yes.
So
And
I'm
also insomnia bullet points.
yeah.
Yeah.
I'm insomnia, this domestic violence, cannula change,
Yes.
and what else? And the colleague and the ethics station in general. This is what I promised, and this is what I'm going to give you, most probably by the end of the course.
Okay. Okay. Thank
Okay,
you very
but don't
much.
worry,
No
it will be
pressure.
just no worries. Actually, it will be provided because just
Okay,
in these
thanks.
days I cannot type many things. Okay.
Said, I'm sorry if I upset you.
No. Okay, guys. So
No. I'm not upset at all. I don't care actually that much. It's all depends on luck.
no, yes.
Yeah, sometimes you will work hard and you'll get nothing. Anyway, no problem.
You will get this time, Dr. Zaid. I'm pretty sure about that. Just positive, okay?
Yeah, okay.
Okay. So good night, guys. See you tomorrow.